Welcome, everyone. Thank you so much for joining us today for a special training. And we are so excited to have with us today our MI coach, Steven Malcolm Berg-Smith. And he's going to lead everyone in this half-day, super interactive workshop to introduce everyone to MI and motivational interviewing and to give many opportunities to practice the skills that he's going to be talking about. So without further ado, I will hand it over to Steven.
Hey, good morning, everyone. Happy Friday. And first off, it is an honor to have this chance to spend a part of today with you. Just so you know, I live in Northern California, and I'm going to begin immediately by showing you my first slide of the day. And you'll see this, of course, pop up on your screen. And what you're looking at right now is a tree that's growing out of this rock. And I've been calling this photo between a rock and a hard place. And I actually took this photo myself in early March, right before we started to shelter in place, at least here in this part of California, and as the pandemic was starting to roll itself out. And this photo I have right above my computer right now, and I look at it every day. And in every workshop presentation I've been doing since late March, I've been showing this image. And for me, it's become a really an important reminder that even in the most adverse conditions, we can choose to continue to grow and change. We can choose to continue to grow and change. And I'd like to offer this image as a centerpiece to our time together today. So we're here to focus on motivational interviewing, or MI for short. And I'm going to guide you all on a journey to support you in having some initial familiarity with this way of working and to support you in developing some basic skillfulness. MI is a very practical, common sense, evidence based approach for supporting people and discovering their internal motivation to make and sustain important changes in their lives. And before we talk specifically about motivational interviewing or MI, let's do a little logistics. We're going to be together until 1:30, and we'll be taking two 15-minute breaks. The first break will be right around 10:30-ish. And if you could give me a little leeway when we officially start that break. Please be mindful about keeping yourselves muted, except of course during those times where you verbally bring your voice into our Zoom classroom. In terms of what you'll need, a blank piece of paper, something to write on, and ideally a printed copy of the handout packet that was sent to you prior. Now, I was just trying to attach it to the chat and that wasn't happening. I'll try that again in a bit. If you're not able, like I said a while ago, to have this printed copy, no worries, we'll work around that. I really want to emphasize that your voices are always welcome here, always. You have a question, a comment, feedback, reactions, please step forward and you have choice in terms of how to do that. You can do it in the chat. Oh, thank you, Sasha, for um, pulling it forward there. And you can also unmute yourself and verbally bring your voice into our Zoom room. So there's that. I'm going to take my little marker right next to the word patience. Patience. So I've been teaching motivational interviewing for more than 25 years. And this is a real important part of my work life. It's not the only thing that I do. And without a doubt, it's the best thing that I do. And I certainly hope that comes across. And I'm saying all this because in April is the first time I ever facilitated a remote online Zoom motivational interviewing training. All of my work has been in person. And I'll just be candid with you all. I'm kind of like an old dog learning new tricks here, and I will make mistakes. This will not be perfect. There will be curveballs. And I'm going to invite all of you to hang in there with me as I manage the technology and this new medium for supporting this kind of learning. So thank you for hanging in there with me. Of course, in Zoom, you have the option in your box of turning your video on or off. My preference is that at least most of the time you have your video on. And the reason why is that I have found that when most everyone has their video on, it definitely supports me in feeling more connected to all of you. It's hard enough having connection in this virtual environment, and it supports me. And I've learned also that it can support you in being more present in this process, which again is not easy, not always so easy when we're working in this way. And of course, there are very good reasons I know why some of you may have your video off, and that will be acknowledged and honored. It's your choice. So I think we're okay in terms of your names. I always want to be able to refer to everybody by their first name. And I think I'm seeing everyone's first name down the list here. So um, that's good. You can rename yourself pretty easily in Zoom by clicking the three little dots in your video box. Um, or you can click participants in the bottom Zoom menu, and your participant menu will pop up on the right hand side. Your name will be on the top. You can click your name and you can rename yourself at that point. So in terms of using reactions, in your bottom Zoom menu on the bottom right hand side is the reactions button. There will be times where I'm going to encourage you all to give me a thumbs up, for example. And let's just practice that right now. If you could all give me a virtual thumbs up so I can see that we're generally on the same page here. All right, we're looking good. Thanks for the thumbs up, and that thumbs up will drop down automatically. In terms of bringing your voice into our classroom, my preference is that you raise your virtual blue hand first, and then I'll call on you. You'll find your virtual blue hand on the bottom of your participant menu, left-hand side. And in fact, if you all could do that right now, so I know we're all on the same page about raising that blue virtual hand. And then once you got your hand up, you can actually lower it. The next step is to lower it. I can lower it for you also, but if you could lower it at this moment. All right, so that's some of the logistics, and I'm wondering right at this moment, what questions, comments, reactions, anything? What's on your mind before we officially get rolling here? All right, I think we're good. So
I did
let's
have a question really quick. Where
sure.
was the raise your hand thing at?
Yeah. So in your bottom Zoom menu, um, if you click participants,
Okay.
and the participants menu should pop up on the right hand side of your screen. You see that? And on
Yes.
the bottom of that menu on the left hand side, you'll see that blue virtual hand.
Mhm.
And I'm
Thank
seeing
you.
a lot of blue virtual hands popping up right now. Not, are those questions or is that just practice? If it's an actual question, unmute yourself and love to hear what's on your mind.
That was practice for me.
Okay, thanks, Amber. So I figured that was the case for most everyone. I'm going to lower hands unless you have something to say, and you can unmute yourself if that's the case. All right, so here we go. What is motivational interviewing? And I have an open-ended question to ask all of you right at the get-go. No matter what you know or don't know about motivational interviewing, how would you define it and characterize what motivational interviewing is, ideally in one or two words? And if you could start placing in your chat how you would define and characterize MI based on what you know or don't know. And once I start seeing your responses, I will start giving voice to what you know or don't know. Ideally, one or two words. If you need more, that's cool. So, open-ended questions, motivating the client to speak their truth. MI is a way to connect and help people move through stuck points, gathering information for change strategies, supporting guidance, conversational dancing, engaging better conversation, active listening. It's a client-centered way of interacting with people to assess where they are in the change process and encourage them to move through the change process. Open questions, letting them talk freely. So overall, you have a general sense of the underlying essence of motivational interviewing. Some of you know nothing at all. Now, if I was to define motivational interviewing in one or two words, this is how I would define it. Draw out, draw out, uncover, awaken, evoke, draw out. Here's a quote from a man named Bill Miller. He wrote the original article about motivational interviewing in 1983. And this is how he simply describes MI. Oh, it is a method of communication designed to bring out the other person's motivations to change. So that is a very simple way of thinking about motivational interviewing. Now I'm going to pull up my first polling question of the day. So based on what we've just focused on, what do you think? MI is all about getting people to make change, giving advice and education, drawing out clients' own motivation and commitment to change, being kind, coaching clients to make important changes in their lives. And you've got a few more seconds here. Love to see as many responses as possible. All right, I'm going to end the poll. Share the results. Here it is. Motivational interviewing is all about drawing out clients' own motivation and commitment to make change. Yep, motivational interviewing is all about drawing out. It's all about drawing out. Now, in motivational interviewing, we have 5 essential communication skills that we used to guide our conversations with people. And we summarize those communication skills by the acronym OARS plus I. And right now I'm holding up my wooden oar. on my screen. I've got it here in my hand. So OARS plus I is key. And this is what OARS plus I stands for. We have open questions, affirmation, reflective listening, big picture summaries, and the different kinds of information that we're in a position of offering people. And I'll tell you right now, 98% of what we do in a motivational interview is found in OARS plus I. Now, I got a transcript of an interview that I'm going to show you in just a moment where the interviewer is doing nothing but OARS plus I, and a little background on the interview that you're going to witness. In late March, I started doing some consulting in King County in Washington State, where Sasha is currently sitting right at this moment. Started doing some consulting there, and King County is the place where that was the original COVID hotspot. And they very quickly trained a group of behavioral health practitioners in motivational interviewing to support people who had voluntarily entered isolation and quarantine sites for 14 days as they awaited their test results or to recover from COVID symptoms. The following interview is with a person who was homeless, somebody who's been living on the streets. And here's the opening of this interview. And to bring it alive, I'm going to need 2 volunteers. And I wonder if one of you could be the interviewer. Raise your blue virtual hand. I'll call on you. And Kat, thank you. So, and Amber, thank you. So I will always reference the first 2 blue hands that I see. So Kat, if you could be the interviewer, and Amber, if you could be the guest, and you'll get started in just a moment. The rest of you, your job is to pay close attention to how this interviewer navigates and guides this conversation. It is very intentional, very intentional. When the interview is done, I'm going to ask you all, so what did you notice the interviewer doing that you think was really helpful, that you think was productive? What did the interviewer do to support a helpful conversation with this guest as they refer to the people who are in quarantine? I want to prepare you that while this interview is unfolding, I'm holding up my drum right now in front of me. This is a little weird, hang in there with me. During this interview, every time I hear the guest speak in a very important way, I'm going to be offering a drum roll to those words. And I'll tell you later what the drum roll all means. But just so you know, that's going to happen, and hopefully that won't be too distracting. Interviewer, you're on. Go.
I heard from your caregiver that you're hoping to be released because you're feeling better. I'd like to talk to you about this for a few minutes. Is this a good time?
Hey, great. Thank you.
First, I'm interested in hearing your perspective. What are your thoughts on this right now?
Well, it's pretty simple. I feel perfectly normal. I'm sick of this place, and I need to get on with my own life.
You're feeling good and ready to get out of here.
That's right.
May I ask what your understanding of how long people remain contagious with the virus?
About a week after they no longer have symptoms?
From your understanding, a week or so after there are no more symptoms.
Yes.
May I share with you our understanding of the contagion period and what we look for before we release someone? Then I'd like to hear what you think about our policy. It's a constantly changing situation, so if you've read some new data that you think we should consider, I'd be very willing to share it with our team.
Okay.
The most up to date research has detected that the virus in some people several weeks after they've recovered from COVID 19. So, to play it safe, the guideline we're using is at least 14 days of isolation after a person is completely symptom free. So, what do you think?
That's a long time.
A long time to be away from what's normal.
The hardest part is being away from my homies.
You're missing them.
Damn right. But I for sure don't want to infect them. It's just too quiet here.
So, protecting your friends is a and it would
Priority.
priority, and it would be easier for you if you had some connection to them.
I wonder if there's a way for me to get on an iPad or something to Skype or Zoom, you know?
Yes, we have several available for just this purpose. We can definitely arrange to get an iPad to you at least once a day for 30 to 40-minute time slots.
That would make staying here a little better. Thanks for having my back.
So, Kat and Amber, thank you. And I'm going to invite all of you to give a shout out to our first two volunteers. My sister is a first grade teacher, and she's taught me that a great way to do a shout out in Zoom is with roller coaster hands. So let's give roller coaster hands right now to Kat and Amber. Thank you very, very much. So I'm wondering, what did you all just notice? What did the interviewer do that you think was helpful and supportive? What did the interviewer do to guide and navigate this conversation in the direction of change? And I'll wait to see a blue virtual hand, or you might even write your response in your chat. What? Yeah, Amber, you were in that important role. What did you notice?
That she convinced the interviewer convinced the guest from wanting to leave to being willing to stay a little longer.
Yeah. So the guest is actually the one who discovered their own reasons. The interviewer didn't tell the guest that they needed to stay. The guest is the one that gave voice to that on their own. Yep. So what else stood out to you in this interview? What'd you notice? What did you think was helpful? So I'm seeing some of your chat responses and I'll give voice to them. So open-ended questions and letting the guest talk freely. There were reflective listening statements. The interviewer did not argue with the client. They validated the client's feelings, reiterated what the guest said, and guided her to an answer. There was powerful active listening. The interviewer was politely informative, which helped the guests understand the importance of staying. Absolutely. So this is a simple example of what a motivational interview might look like. And just so you know, no two interviews are exactly the same. They all have a life of their own. And here's something important to look at. We're going to deconstruct what played out. Hey, Raquel, I see your hand up. Yes.
Okay, thank you. I was just typing in the chat, but right from the onset, I noticed that the caregiver allowed the guests to reiterate their concerns. I'm sorry, the interviewer had
Yeah.
heard from the caregiver, but wanted to hear the guest reiterate or confirm the concerns.
Yeah. So, and Raquel, thank you for bringing your voice forward. So the interviewer did a great job of reiterating the guest's concerns and also guided the guest to give voice to their own motivations in continuing to stay. Kat, yes.
The interviewer didn't act like smarter
Oh, yeah.
than the guest.
Yeah.
She said, we have this information, but if you know something we don't, let us know and we'll take that into consideration as well.
Oh, yeah. So the interviewer was incredibly respectful and was treating the guest as an equal, partnering, joining with this person, the interviewer not looking down on this person, sitting, so to speak, side by side with them as another human being, which is essential. So fine tuning, fine tune look at what happened. Let's deconstruct this interview. The interviewer began by asking a close-ended question. Is this a good time? A yes or no question. And in motivational interviewing, we generally shy away from closed questions because we know that kind of question does not support change generally. And there are times where we do ask close-ended questions. It's not that we don't ever ask them. Sure, we ask them sometimes. And a classic time that we might ask a close-ended question is when we're asking permission. Because in motivational interviewing, generally before we broach a topic with somebody, before we start offering something, education, information, advice, or feedback, we generally ask permission first because we know that people are more likely to make change when their autonomy, their self-determination, and their freedom of choice is honored and recognized. This is a key principle. Then the interviewer asked an open-ended question because in motivational interviewing, you want people to talk in certain ways. We know from years of research that people are more likely to make change in conversations based on what they tell me versus anything I might say or do. So the voice of the client is key. Then the interviewer offered a reflective listening statement. This is probably the most important thing I'm going to say today. We have learned over the years from tons of research in conversations, people, clients are more likely to make change when they feel understood. When people feel accurately understood, they're more likely to move in a positive direction. They're more likely to make change. The way we show somebody we understand is with the skill of reflective listening. Then the interviewer asked another open-ended question. Before we start offering somebody something, we always want to find out what the person already knows, what kind of wisdom they already have. And then we have another reflection, and then asking permission once again. Because before we make an offering, like I mentioned a moment ago, we ask permission first. The client, the guest says yes, okay. And then the interviewer makes an offering. In motivational interviewing, we don't give information. We don't provide information. We don't impose information. We offer it. And an offering is always a choice. And the person can choose to take it or not take it. And we know it's an offering when there's asking of permission first. And then after the offering, the interviewer asks another open-ended question because we know that people are more likely to hear and receive what it is we have to offer based on what they say about it, based on what they give voice to. So an important open-ended question, another reflection, another reflection, another reflection, and another moment of offering information. In summary, this is what the interviewer did. They asked three open-ended questions. There were 2 close-ended questions, and in both those cases, asking permission. 5 reflective listening statements, and 2 times where they offered information. We know from the research when the choreography of an interview plays out like this one, this is definitely a conversation that is most likely going to move in a positive direction. So before we deconstruct this interview even further, what questions do you have right at this moment? Concerns, learnings, feedback, anything? What do you want to give voice to that I've just said? All right, so something important to take a look at. In your handout packet, if you all could turn to page, actually, did I include this page? That's okay. I didn't include that, and that's cool. All right, didn't include it. So motivational interview, sorry about that. So motivational interviewing, as you're going to figure out pretty quickly here, this is a communication art form, and it's also a science. And we know from the evidence how we respond to people will predict how people will respond back to me. One of the important standards that we emphasize in motivational interviewing is the percent of open-ended questions I ask people, because we know that most helping professionals primarily ask close-ended questions. And in motivational interviewing, we want to turn that around so that when I'm learning MI, at least half of the questions I ask people are open-ended. Now, another important standard is what we call the reflective listening to question ratio. We know, as we'll talk a lot more about in a bit, most helping professionals rarely reflect back what people say. In motivational interviewing, we want to eventually start doing a lot more reflecting than asking. And when folks are first learning MI, one reflection for every question. So as you can see with our interviewer, there were mostly open-ended questions, and the ratio of reflections to questions is a 1-to-1 ratio. Now, last but not least, the voice of the client is key. In motivational interviewing, we pay a lot of attention to linguistics. What people say matters. And we know from the evidence that most people have 2 voices within them. Most people have mixed feelings. Most people are in an internal conflict. I do and I don't. Here is the mixed feelings of this guest. This was actually with another guest, so hang in there. But pros and cons, mixed feelings. And what's really interesting is we know that these mixed feelings are normal. The ambivalence is normal. It's a defining state of being a human being. And we expect people to say things like, I need to, but don't want to. I'd like to, but don't think I can. We know that just exploring with somebody their ambivalence, their mixed feelings, can stimulate and increase motivation for change. It can release energy. It can release motivation. A primary goal in our motivational interviewing is to explore, understand, and potentially resolve a client's ambivalence. Now, last but not least, we got these words in red, but I for sure don't want to infect them. That would make staying here much easier in a motivational interview when I'm supporting somebody in exploring their mixed feelings. I am intentionally guiding that conversation in the direction of the reasons for change, the arguments for change. The words in red are what we call change talk. Any client speech in favor of changing something that client has agreed to speak with me about. Now, got an important quote in front of you, and I wonder if one of you, a new voice, might be willing to raise your hand, and if you'd be willing to read these important words. Martisa, thank you. If you could unmute yourself and if you could read these words, please.
MI is a particular way of having a conversation about change so that it is the client rather than the clinician who voices the arguments for change.
Thank you very much. In motivational interviewing, we want to support clients in telling us what we're usually telling them. We want clients to be the ones giving voice to their own reasons for wanting to do something and coming up with their own ideas for making things happen. This is a primary principle of motivational interviewing. I'm going to pull up another polling question. So based on what you know, or you think you know about motivational interviewing right now, here's the question. Motivational interviewing is all about what? Following clients, directing clients, or guiding clients? A few more seconds to make your decision. I'm going to share the results. Motivational interviewing is all about guiding people in the direction of change. It's the sweet spot between following and directing or dictating or pushing or convincing. So MI is all about gently navigating conversations with people in the direction of their own motivations. So moving on here. Here is the definition of MI that we're going to be working from. There's many definitions out there and we're going to use this one. Oh, motivational interviewing is a client-centered guiding method of communication and counseling to elicit and strengthen motivation for change. What's important about this definition is this. In motivational interviewing, we put the person we're serving behind the steering wheel. We want clients to feel in charge. We want them to feel empowered. And at the same time, I am the one who is guiding the conversation. I am the one guiding the conversation in the direction of the client's motivations, and I'm using my ORs plus I. I'm using my ORs plus I to do that. A very simple way to think about motivational interviewing. This way of working is all about dancing and not wrestling. Motivational interviewing is all about connecting with people, and it's not about fixing them or correcting them or pushing them or dictating towards them. No, it is all about joining and partnering and dancing. We have a primary goal in motivational interviewing, and there's two parts to this goal. The first part, I want to do no harm, and I want to work in a way that is going to reduce resistance. I want to work in a way that's going to prevent pushback and kickback. I want to work in a way that's going to diminish any discord and disharmony with that person I'm serving. And I work in a way to soften what in motivational interviewing we call sustain talk. Sustain talk. Sustained talk is the opposite of change talk. It is any client speech that favors the status quo, that favors no change. And this is a voice that we know a lot about. We hear it every day when we're working with people in motivational interviewing. We normalize it. We don't pathologize it. We expect it. And when I hear this voice, I want to hear it. I want to understand it, and I want to learn from it. And I work in a way to soften this voice. And I wonder if a new voice would be willing to unmute themselves and read these examples of sustained talk. Sustained talk. Austin, you had your hand up earlier. I wonder if you'd be willing to unmute yourself and read these words, please. If Austin is there. Hey, Austin, thank you.
Yes.
If you could read these words of sustained talk, please.
I'd rather not be here. I can still use and function pretty good. If I quit treatment, at least I'm free. I'm not putting up with this anymore.
Austin, thank you. If you could keep yourself unmuted, because I'm going to have you read some other words in just a moment. Hey, this is a voice that I definitely want to empathically hear. And I want to understand this voice. I want to learn from it. And in motivational interviewing, I don't want to amplify this voice. I don't want to leverage this voice. I want to soften this voice because what people say matters. And if we're actually encouraging people to speak in this way, we're actually supporting that person in not making change. Now, here is the heart of motivational interviewing. Evoking change talk. Evoking change talk. You'll notice right above my head, on my bookshelf behind me, there's a heart. There's a heart, and that's up there to remind you that evoking change talk is the heart of motivational interviewing. And I have some examples of what change talk sounds like. And Austin, you're going to read these words in just a moment. And what I'm going to be doing is every time Austin reads these examples of change talk, I'm going to drum for these words, and I'll tell you why I'm doing that in just a moment. Austin, go for it.
I don't have many other options right now. I guess treatment is my best bet. I've handled a lot in my life, and I can meet challenges if I want to. If I don't get a roof over my head, it makes looking for work too hard.
Austin, thank you very much. In motivational interviewing, this is the voice that I want to cultivate. This is a voice that I want to grow. This is a voice that I want to deepen. And I'm drumming for this voice because part of becoming skillful in motivational interviewing is becoming very sensitive to change talk, because I don't want that voice to go over my head. When I start to hear change talk from a client, it's a signal that what I'm doing is working. And I want to keep the conversation moving in that direction. And we're not going to drum for people. And symbolically, you want that drum roll to go off inside you. Now, I want to make sure right at this moment we're on the same page in terms of change talk. And which of these statements would you say is an example of change talk? I want to start making money, especially right now during the pandemic. There's no way I can get a job. I'm too lazy to look for work. Where's the change talk here? You got a few more seconds to make your choice. And I'm going to end the poll, share the results. Which of these statements is an example of change talk? I want to start making money. Now, especially right now during the pandemic, there's no way I can get a job. I'm too lazy to look for work. Those two statements, the voice of sustain talk, the opposite of change talk. Oh yeah, we expect that voice. We want to hear it. And we don't want to spend too much time in that place, because the longer we spend with that voice, we actually begin to reinforce a no change position. The voice that I gently want to navigate the conversation towards is that voice of change talk. Let's do one more. Which of these is an example of change talk? I won't ever quit vaping. If I quit vaping, I'd probably be healthier. Vaping is better for your health than smoking cigarettes. I'm going to end the poll. Which of these statements is an example of change talk? If I quit vaping, I'd probably be healthier. There's the voice of change talk. And as you'll see during the rest of our time here, change talk is going to be a primary focus of what we are going to address. Change talk. Any client speech that favors movement in the direction of healthy behavior change. So let's circle back to the big picture of what we're doing today. And we're going to wrap up no later than 1:30. We'll be taking our first 15-minute break right around 10:30ish. And again, if you could give me a little leeway when we exactly start that break. I'm going to be showing you a lot of slides today. At the end of the day, I will know which slides I have shown you, and I will send my complete slide deck to Sasha. And Sasha, if you'd be willing to distribute these slides to everyone, so you will get everything that I show you here. We have a North Star, 4 things that I'm hoping you all walk away with from this very brief exposure to MI. And like I said at the beginning, I hope you walk away with the foundational understanding and a basic skillfulness in MI. And I hope you walk away with one new idea that you can bring into your work life immediately to fine tune what you're already doing a great job of. And I, I hope you walk away with a desire to learn more, because I'll tell you what we're doing in this half day together is a drop in the bucket. And this is potentially the beginning of a long journey, because we know that to become really skillful in MI, it's something you're always working at and always growing and developing in. And lastly, I hope you all walk away with a bit more confidence in your ability to inspire and activate and call forth another person's internal motivation to move in a more positive direction in their life, to find their best self, to make important changes related to their living situation. So, how does that sound? Our North Star? If this sounds good, if you could all give me a thumbs up, either a virtual thumbs up or an actual thumbs up in your video box. Either way, so I know we're on the same page. All right. Ooh, I'm getting thumbs up everywhere. This is good. This is good. So I'm going to move on here with you. And in your handout packet on page 1, on the bottom of the page, you're going to see these 4 words: show up and beginner's mind. These words are going to be our training guidelines, our workshop guidelines. Let me explain. In the years that I've been guiding the learning of motivational interviewing, I've learned the importance at the beginning of a workshop to bring forward, show up in a beginner's mind. And have found that when a group honors these guidelines, these are not rules, they're guidelines. When a group honors these guidelines, the training goes by really fast, and you're definitely more likely to walk away, with the foundational proficiency. So show up. So for today, be here, be present, full-hearted, have both feet on the floor in front of your device, to not have one eye wandering and looking at other things on your screen, which is hard. To do what you can to have both eyes focused on what's happening, bringing forward your undivided attention, a willingness to be engaged, a willingness to participate, a willingness to volunteer. We know that people do not become skillful in this way of working by hearing somebody talk about it and show a bunch of slides. We know that people do not become skillful by watching examples of it or reading about it. It's something you have to do and experience and practice. So for that reason, naturally, I'm going to encourage you all to show up today. And the second guideline is this. I'm going to encourage you all to park outside the room you're sitting in right now everything you think you know about motivational interviewing, everything you think you know about motivating change in people. Park it outside the door. Clean your internal slate. And right at this moment, begin our time from a place that is very flexible, very receptive, an attitude and mindset that is really curious and inquisitive and non-judgmental and quiet, an attitude and mindset that is open to possibility. And this is in contrast to the attitude and mindset that thinks they're already an expert. I already know this shit, this is such a waste of time, I was made to be here. I'm going to encourage you to park that voice outside the room you're sitting in. To park the voice that immediately dismisses, that pushes away, that the voice that complains, the voice that's their curmudgeon, the voice that doesn't really want to learn anything new. It's been suggested in the beginner's mind, the possibilities are endless. And in the expert's mind, the attitude and mindset that complains, the curmudgeon is inflexible, that pushes things away, that thinks they already know everything. You all know this, the possibilities are about this big, about this big. So this is a starting place because we're actually going to officially start the training right now. I've been doing the prep work with you all, and if this sounds good, show up beginner's mind. If you could give me another thumbs up, either virtually or a live thumbs up in your video box so that I know we're on the same page. All right, and if you've got questions or anything right now, you let me know at any point. I'm going to move forward here. I've got an important question to ask you. You'll be answering this question on the front cover of your handout packet. Here it is. On a scale of 0 to 10, how confident, honestly, are you in your ability to mobilize and activate clients' internal motivation to make and sustain important changes in their lives, the kind of changes that you're supporting people in making around housing, around having a roof over their heads, around their life on the streets. Just so you know, a 0 is I ain't got no confidence. 10 is I've never ever met somebody I haven't been able to inspire and motivate. Please circle a number. I'm going to ask you the same question in a poll, and I only am able to place 10 digits in this polling question, so there's not a 0 in this case. So what number are you? How confident are you? And if you're a 0 in this case, you're of course going to be a 1. And I'd love to see as many of your responses as possible. Keep them coming. How confident are you? Ten more seconds. I am going to end the poll and share the results. And as you can see, we have the number 1, the number 3, the number 4, 5, 6, 7, 8, and 9 represented. The number that, of course, is most populated is the number 6. I'm going to ask you the same question today, right about 10 minutes past 1 o'clock, to see what, if any, changes happen in your confidence, in your ability to activate and mobilize change in those people that you serve. Now, I've got another important polling question to ask you, but before I ask the polling question in the poll, I'm going to do it here first, and let me explain. So, like I mentioned at the start, all of my trainings over the years have been in person, and doing online virtual remote learning, completely new. I'm trying to figure this out. What I prided myself on over the years is crafting trainings and facilitating workshops that are very hands-on, very interactive, a focus on skill building, using a lot of different learning modalities. And I'm going to do the best job I can today with you to support our time in being interactive and hands-on. And one of the activities I plan on doing with you several times is what we might classically call role playing. And what I mean by role playing is this: you'll be randomly assigned a partner in a breakout room. With that partner, you're going to decide who is going to be an interviewer and who is going to play the role of the client. And the client is actually going to be themselves. And the person playing themselves is going to talk about something real in their life that they feel okay about talking about. And then the interviewer, based on my guidance, is going to take their partner through an interview. So generally, that's what I have in mind for role playing. Before I'd even consider doing that with you, I definitely want to get a sense on how you all might feel about it. So here's my question, and please don't circle a number until I complete the whole question. On a scale of 0 to 10, how comfortable are you with the idea of participating in some real play activities on Friday, October 9th? And just so you know, a 0, I hate role playing. I don't want to role play today. That's not why I'm here. This is actually a break from work. And I just want to sit back and watch. I'll be present. I really don't want to have to do, today I got a headache and I've been dealing with my kids. There's so much going on. The pandemic is driving me nuts. I just don't have. So I want to assure you, if you're a 0, that is going to be honored and respected. On the other hand, a 10. I can't think of anything I'd rather not be doing on October 9th than real playing, because me and real playing are best friends. We're like that. You get the idea? Circle your number. Honestly, where do you stand right at this moment? I'm going to ask the same question in a poll. How comfortable are you with the idea of participating in real play activities during this training? Honestly. Really important question for me to know about, because I want to meet you all right where you're at. All right, I'm going to end the poll. I'm going to show you where you stand here. As you can see, we got 1s, 2s, 3s, 4s, 5s, no 6s, and we've got 7, 8, and 9. And the number that is most populated is the number 2. Thank you so much for letting me know where you're coming from. This is so important for me to know right at this moment. And in just a bit, I'd actually like to chat with you all some more about where you placed yourself up here. We'll get back to that. Thank you. So moving on. I have a client that I'd like to introduce you to. This is a real person, definitely a real person. In your handout packet, turn to page 2. Let me tell you about this client. He's a vet. He struggles with depression. He has a prescription, and in terms of taking his meds, he is very inconsistent at best. He's currently unemployed. He's temporarily living in a friend's trailer, and when he's not in the trailer, he's on the streets. He had a major heart attack 2 years ago. Huge event for him. Completely turned his life upside down. It was actually what led to him being homeless. He basically gets no physical activity. He's very overweight, and I will mention that once a year there is an annual hunting trip he goes on in the fall. He smokes about a pack of cigarettes a day. He drinks a fair amount, about 20 standard drinks of alcohol a week. He's a dad. He has a 10-year-old son. He's divorced. He sees his boy every other weekend. And when he's with his son, he smokes around him in confined places like the trailer. Now, that's just a general flavor of who this gentleman is. Right now, I'd like you all to pretend that you're actually going to meet with him. You're going to have a one-time 5-minute conversation with him to make a difference. And here's my question. If you had 5 minutes to meet with him, one conversation, what are the kinds of things you would say and do that you think would be helpful, that you think would be constructive? The kinds of things that you might say and do that might guide him in the direction of making some change in his life. On page 2, on the left-hand side of the page, in the next minute, if you all could start brainstorming the kinds of things you would say and do if you had 5 minutes to make a difference. You're on your own right now. No essays, just brief words, not in your chat, on a piece of paper or on your handout packet. What would work? What would make a difference? You all are making a difference every day in those folks that you're serving. If you were sitting down with this client, what would you do? What would you say that you're pretty certain would be helpful? So I'm ringing my bell, and I have different ways of calling your attention. If you could stop your brainstorming, that's perfect. Now, I've got another question to ask you. I'd like you to imagine that you have 5 minutes to meet with this gentleman. If you had one 5-minute conversation with him, what are all the things you could imagine saying and doing that would make things worse, that would immediately evoke reactivity, pushback, kickback, resistance in him? On the right-hand side of the page, briefly, no essays, start to jot down the kinds of things you're pretty certain would not work with him, would not work. Now I'm going to stop you very quickly. You're going to have another opportunity to add to your list. I wanted to show you this slide. One of the silver linings in my case of working completely from home right now and lots of sheltering is that I've been doing more reading than I've done in years. I have a 13-year-old daughter, and this summer I read the book To Kill a Mockingbird with her. And while reading the book, I came across this classic quote: "You never really understand another person until you consider things from their point of view, until you climb inside their skin and walk around in it." I'm going to encourage you all right now to step in the skin of this gentleman, step into his shoes right now. And what would not work for him? What would he not want to hear? What would he not want you to do? And on the right-hand side of the page, if you could add to your list, what would not work? What would not work? Great. If you could stop where you're at. Thank you for doing the brainstorming. So I want to tell you one reason why we just did this. Because you already know what the essence of motivational interviewing is all about. You already know exactly what motivational interviewing is not all about. Motivational interviewing already lives within you. If this is your first exposure, if you've never even heard about it until today, I'm going to make the argument that you know MI. You know MI. What motivational interviewing does is that it gives structure. It provides scaffolding for what I already know in my heart is truly the most helpful way of engaging somebody and supporting somebody in making important change in their life. I'd like to tell you all a story right now, unless there's some questions or comments about anything before we carry on here. And I'll wait for a blue virtual hand if there's something that you want to bring forward right at this moment. All right, so here's my motivational interviewing story. I first became exposed to motivational interviewing. It was a long time ago. Haley, yes. And please unmute yourself. I'm ready. Or maybe that was just a practice hand up. All right, I'll carry on here. So I was first exposed to motivational interviewing in the early 1990s. I was living and working in Portland, Oregon. And I was working at a health research center. And during that time, we were testing different kinds of brief interventions to support people in making changes connected to addictive behaviors. During this time, we learned about a book that had been published in 1991 called Motivational Interviewing by Bill Miller and Steve Rolnick. This book was passed around our work team, and to this day I can remember reading the book because I brought it home one night with the intention of just cracking it open after dinner and browsing through it. I opened that book, I could not put it down. I read that book cover to cover into the wee hours of the morning, and while I was reading it, I kept saying to myself, oh my gosh, somebody has put into words exactly what I believe. Somebody has put into words a way of supporting people and making change that makes complete sense. It's so accessible. And I want to learn more about this. All of my colleagues had the same experience. We quickly contacted one of the co-authors, Bill Miller, who was at the University of New Mexico. We invited him up to Oregon to teach us motivational interviewing. He spent 5 days with us, a Monday through a Friday, a deep exposure to MI. And all of us that were at that training would say right at this moment, like I am, it was transformational. And I wouldn't be here if it wasn't for that 5 day experience. It became evident quickly that we needed to start bringing motivational interviewing into our research. And I'd like to tell you about our first study. We hired a group of people that we called health and wellness counselors. And these counselors were placed in primary care clinics throughout the Portland metro area. And their job was to partner with a healthcare team, doctors, nurses, dietitians, and so forth. And if one of the providers met a patient who really could benefit from making lifestyle behavior change, this counselor was immediately referred to that patient, and the counselor would meet with the patient one time and would offer a 5 to 15 minute brief motivational interview. So I'd like to tell you about one of the first patients I met with during my first week on the job because I was one of the counselors on our pilot study. And here's the situation. It was a Friday, like it is today. And I was getting ready to head out the back door of the clinic for the weekend. And before I could get out the back door, one of the doctors on the team came rushing up to me in a panic. And he said, Steve, hold on. Before you head out the door, I got a really big favor to ask you. I got a patient in exam room B. I don't know what to do with him. This guy's driving me crazy. He's here today because he has another upper respiratory infection. You know, the guy reeks of smoke when he comes in here. I know that he smokes like a chimney. I've been banging my head against the wall trying to get this guy to quit. Could you go in there and get him to quit smoking? The doctor asked me that question. It completely stopped me in my tracks. I became immobilized right then and there. I looked like, I'm sure, like a deer looking into headlights. And while I'm standing there in my stunned state, I start remembering something that Bill Miller had said during that 5 day MI training. He said, remember this, you cannot make anybody do anything. You can't get people to make change. If you think you can, you're walking in a fantasy land. It's an illusion. It's an act of arrogance, thinking you can make people change. However, there's something that you can always do. You can always engage somebody in a conversation. You can always extend empathy and compassion. You can always honor another person's autonomy. And you always have the potential to invite people to start thinking and talking about the possibility of making change. So I'm remembering Bill Miller's words. My eyes soften, I look at him, and I said, sure, I'd be happy to talk with this patient. So I quickly made a pivot, went back to my office, dropped my things off, started heading down the hallway to exam room B. And right as I came up to the door of exam room B, this doctor comes rushing back. He puts his hand out and we shake. Of course, this is pre-pandemic. We shake hands and he said, Steve, I just want to thank you so much for your willingness to talk to this patient. And he said, this is amazing that you're here. He said, I've got so much to learn from you. And this is going to make my job a lot easier because the reality is most of what I'm dealing with here are matters of lifestyle and behavior. And he said, I also wanted to give you a heads up. Heads up. The patients that's in there, he he's really resistant. He's really hard to work with. And in fact, he's probably one of the hardest patients I have ever encountered. And I'm not saying that to scare you. I'm saying that to get yourself ready. And I figure that you're going to have no problem with him, probably because of how you've been trained. This doctor took off. He left me standing in front of the exam room door. And now my heart is pounding. And I take a few deep breaths. I call forth my inner courage and I knock on the exam room door and there's no answer. I knock again. There's no answer. I knock a third time and you can hear a pin drop and you probably know what I'm thinking. I'm thinking two things. He's either left, he's bolted, he's gone. He's in the parking lot smoking, or something's happened. And to make sure everything's okay, I open up the exam room door. And the room is pitch black. And before I could turn the light switch on, a man steps out of the dark. This is a true story. About this tall, about this wide. He got in my face. He put his index finger physically in my chest, and he started screaming at me and spitting at me. To this day, I can smell his breath. This is exactly what he said. If you're here to talk to me about my blankety blank smoking, you might as well get your little blankety blank out of here because smoking's my blankety blank business. Now, you all know exactly what I did at that moment because now instincts start operating. I started backpedaling down the hallway. And as I'm backpedaling down the hallway, I begin my motivational interview with him. Now, what's happening right now is weird, and hang in there with it. I'm shaking this golden egg, and whenever I shake this golden egg, that's to let you know that I am stepping out of my role as the trainer, and who is now sitting in front of you is somebody who we're going to call Malcolm. Malcolm is actually Steve's middle name. Malcolm is going to be our trainer commentator. So right now it's Malcolm speaking. Hey, Steve is going to finish this story right before 1:30 rolls around. He's going to finish this story right at the end of our time together. And you're probably thinking, that's not fair. It's not fair because Steve has just left you all hanging. He's left you hanging. And let me tell you why Steve has left you hanging. Because he's learned that a good motivational interviewing training is really supported by a good cliffhanger story. And and Steve has learned over the years that by the time we get to tomorrow afternoon at 1:30, you all will know pretty much exactly the first thing that Steve said as he was backpedaling down the hallway. And you probably are going to have a pretty good idea of how the conversation unfolded and what Steve did. So that's why he's leaving you hanging. Now, something important that Steve wants you to know. The the patient that he met with who put his finger in his chest is the same person that you were doing some brainstorming with. And Steve wants you to know that he actually ended up talking with this person in the exam room for about 10 minutes. Towards the end of 10 minutes, this man made a commitment to quit smoking. With Steve's support, he created a plan. Steve followed up with him over the course of many months. And as far as Steve knows right now, that man is still smoke free. So Steve will finish the story. Hang in there with this back and forth between Malcolm and Steve, and let's invite Steve back into our Zoom room right now. So it's me again, and I know that's a little silly, and it's just one of those things I've been learning in working in this virtual environment that can support what's happening here. I will definitely finish the story. So we're going to begin our break in about 10 minutes. And to set the stage for our first 15-minute break, if you could turn to page 2 once again. On page 2, on the right-hand side, you all did some brainstorming. If you had 5 minutes to meet with this gentleman, what are the kinds of things that you might say and do that would probably make things worse, that would probably evoke and draw out of this person some reactivity, some pushback, some kickback, some resistance? And you've placed those things on the right-hand side of the page. In your chat, if you could start to place and write down some of the things that you're very certain would not work with him. And let's get those responses in. And in just a moment, I will start to give voice to, from your perspective, what would not work with him standing in his shoes. So you know exactly what would not work. And let me give voice to some of those things. Shaming him, saying, hey, I heard you had a problem. Immediately trying to get him into a recovery program. Saying things like, you need to, you should, you have to. Asking him interrogating why questions like, why would you smoke in front of your son who has asthma? To start telling him why he shouldn't be doing what he's doing. Smoking isn't good for you and your boy. You know, you really shouldn't drink and smoke. And there's that old saying that most people don't like to be should on. And we got lots of should in here. Telling him what he needs to do. Telling him that smoking is not healthy. Starting to talk to him about being unemployed. Talking to him about his living situation. Arguing why he should make change. Telling him to quit drinking, to get more exercise, to treat him like he doesn't know what he's doing, to let him know that you are the expert. Man, you know exactly what would not work. Now, the primary goal of motivational interviewing is to do no harm, to prevent kickback and pushback, and to reduce resistance, to reduce resistance. And over the years, we've learned a lot about resistance. We've learned a lot. And I've got a question right now in a poll. about resistance and just want to get a sense on where you stand with this. What do you think? Client resistance is primarily a byproduct of what? Excuse me, is primarily a byproduct of the interpersonal style and underlying attitude of the helping professional. What do you think? What do you think? So a few more responses. You've got a few more seconds. Love as many of you to get on board here as possible. I'm going to end the poll, share the results. This may be a surprise. The evidence is very clear about this. Client resistance is primarily a byproduct of the interpersonal style and attitude and manner and tone of the helping professional. Yep. I'm going to bring you back to our slide. And this is important. We know that resistance usually doesn't arise out of nowhere. Resistance usually arises in the context of a relationship. Resistance is a relationship issue, which means we can impact it. Resistance is kind of like the volume on our car radio. When we're meeting with somebody, we can support resistance in going up or down, fine-tuning that knob on your radio. And we can support resistance going up or down based on my attitude, my manner, my orientation, my tone, my perspective, my mindset, my style, and my spirit. And one of the important ways that we can impact resistance is to stop doing all of the things that we've always done that don't work. And on my handout, which I'm holding up in my video box, I put a big X through everything on the right-hand side of the page. And I'm going to encourage you all to do the same. One critical way of minimizing resistance is to stop doing what doesn't work. Now, part of becoming proficient in motivational interviewing is to manage and suppress what we call the writing reflex, to tame it. And this is a reflex of the heart. This is a reflex that wants to help, that wants to make a difference. And in this way of working, we have to start doing something that is very unnatural. We have to tame that reflex. We have to suppress the reflex that we all have to start fixing. And we all know what fixing looks like. And what you're looking at are some classic examples. And I was hoping that two of you could read through this list of fixing. Somebody who could read the words in blue and rotate with somebody reading the words in black. And ideally, two new voices. Raise your blue virtual hand. Okay, Janelle, if you could read the words in blue, and who could read the words in black? Tasha, thank you. Both of you could unmute yourself. And Janelle, if you could start with confronting and start going down the list and alternating.
Okay. Confronting,
pressuring,
taking charge,
nagging,
scaring,
talking down to,
ordering,
judging,
labeling,
scolding,
pouncing,
showing the way,
persuading,
criticizing,
directing,
interrupting,
rescuing,
shaming,
exerting authority,
premature action,
Information overload.
Cheerleading.
Part of becoming, thank you to both of you. And Tasha, if you could actually keep yourself unmuted, because I'm going to have you read something else in just a moment.
Okay.
So part of becoming proficient in motivational interviewing is we have to stop doing what doesn't work. And of course, we don't do these things all the time. And we tend to do these things when we don't know what else to do. So in MI, I have to become very conscious, very diligent, very mindful about not fixing. So here, Tasha, if you could read these words, this is an example of the writing reflex, talking to a teenager. Go for it.
You have to stop smoking weed. Do you know that it stunts the development of your brain? Here's what I think we need to do. Let's get you connected with our substance abuse specialist. I really care about you, so I want you to get help.
Tasha, thank you. Hey, this is a voice that we all know. We all know. And part of becoming proficient in MI, we have to learn how to manage and suppress and tame the reflex that wants to respond in this way. Here's Bill Miller once again, and he's going to say a few things about the writing reflex.
Well, Steve Rolnick and I have written about the writing reflex, which I think comes with being a helper. It comes with wanting to make a positive difference in people's lives. And when you see someone going down the wrong road, somewhere that's going to lead them to painful outcomes, you want to run around and get in front of them and say, stop, go back, don't you see? I mean, go this way instead. And it's just a natural outcome of that desire that draws us into helping, which is fine. But the problem is what happens when you do that with an ambivalent person. When you take responsibility for the change, when you say, this is a problem and here's what you need to do, you elicit from the client exactly the other side of the ambivalence because they have both sides inside of them. And so they're then likely to say, well, it's not that bad, or I'm not sure I need to do that. And you wind up kind of acting out their ambivalence between the two of you, with you taking the good lines and you leaving the more resistant or reluctant lines to the client. And that's not good because we hear ourselves talk. And as I hear myself talk, I get committed to what I'm saying. So ironically, if you follow your helper instinct and try to advocate for and persuade and coax and cajole and coerce and confront people into changing, you can actually have the paradoxical effect of eliciting from them lots of resistance, which makes it less likely they're going to change. And so I think that those behaviors come out of the best of intentions and come from a heart of wanting to help. But we have to learn to suppress these. And after 20 years of practice, 25 years of practice of motivational interviewing, I still have to suppress my writing reflex and my desire to take up the good side of the argument. Now, because I know that's not the best thing to do, and instead to let the client make those arguments.
Thank you, Bill. So part of becoming proficient in motivational interviewing is to become very diligent about not getting into wrestling matches with people, to not getting into tug of wars, to not counter punching, and learning to do something which is so hard. And that is learning how to let go. And letting go doesn't mean I don't care about people. It doesn't mean that I'm not going to extend empathy and compassion. It doesn't mean that I'm going to deliver the best intervention possible. It doesn't mean that I'm not going to guide people in the direction of change. What it means, when everything is said and done, I cannot be personally interested or emotionally invested in this person making change. Because if I am, I run the risk of pulling out the hammer and starting to fix. We'll be talking about letting go, which is so important in this way of working. So I'm going to be bringing forward something that I call motivational interviewing sign language. Different ways that we might recognize different aspects of what might happen in an interview somatically or kinesthetically. In other words, creating a kinesthetic anchor to different kinds of behaviors. So our kinesthetic anchor for fixing the writing reflex is the hammer. And I'm actually going to encourage you all right now to put both of your fists together and to start hammering. To start hammering. And now stop the hammering. One last scenario, just so you know, we got a break coming up really quick here. Healthcare professional talking to a pregnant 18-year-old about maintaining a healthy diet, adhering to her meds, and practicing safe sex. Her first language is not English. I have a transcript of this interview. To bring it alive, need 2 volunteers, ideally 2 new voices. Who could be the provider? Destiny, thank you. If you could be the provider and looking for a client. Kathy, thank you. Destiny is the provider. Kathy is the client. The rest of you, your job is this. Every time you hear the provider starting to fix, starting to tell, shame, push, convince, dictate, coax, pressure, your job is to start hammering in the moment, wherever you're sitting. So bring yourself into this with your body. Provider, go.
Good morning. We're talking today because we don't want you to have a HIV positive baby.
It's difficult because what about if my boyfriend wants to have sex with me?
You need to use a condom.
But he doesn't want to use a condom.
The problem is that you can get reinfected. For the sake of your baby, you need to discuss this with your boyfriend. If you want this baby.
Yes, I want this baby.
Well, if you want a healthy baby, you need to discuss this and work it out with your boyfriend to use condoms as responsible parents.
But he gets mad sometimes and hits me.
You have to protect the baby. Are you taking your medications?
Yes, when I can. Sometimes I miss doses.
You really need to take all your medications faithfully. That's very important. You miss doses, if you miss doses, the medications don't work as well.
I do take them most of the time.
I'm afraid most of the time isn't good enough. You need to take them all the time as we discussed.
I'll try.
And how about your diet? Are you eating good food for you and your baby?
Yes.
Because you are eating for 2 now, make sure you don't drink any alcohol. It's not good for the baby. Do you have any questions?
No.
All right. I'll see you again in 3 weeks.
Okay.
First off, Destiny and Kathy, my apologies. That's painful. That's awful. And it's horrific. And what's so sad is that this comes from a real transcript. And you might think, well, this doesn't happen anymore. This way of working happens all of the time. Part of becoming proficient in motivational interviewing is to put down the hammer. One of my motivational interviewing trainer colleagues, Greg Merrill, who's on the faculty social work department at University of California at Berkeley, says, whatever you do, refuse to confront, control, argue, persuade, lecture, reason with, blame, shame, or otherwise vehemently disagree with your client's resistance. In other words, don't spin your wheels until you have some traction. Why waste the gas when the price is so high? Right now, symbolically, I'm going to encourage all of you to put your hammer away, to leave it in a place where you can't reach it. Because to become skillful in motivational interviewing, I do not want to be able to easily access the hammer. what I'm going to do with my hammer, which I'm holding up right now, is I'm going to stand up, I'm going to take my headphones off, and I'm going to put this hammer on the upper shelf of my bookcase that's behind my head as a symbolic way of supporting all of us to stop fixing. I'll be right back with you very quickly. All right, so for the rest of our time, we're done with hammering, we're done with fixing. If you all could turn to page 10 in your handout packet. Page 8, page 8. Page 8 is what we're going to call our pearl bucket. And the pearl bucket is where you're going to leave your key learnings from our time together, the things that you don't want to forget. What's relevant here that you can bring into your work life. And before you add your pearls, I actually have a pearl that I'm going to invite you to place in the bottom of your bucket. And that pearl is no fixin', no fixin'. And then once you've placed no fixin', the bottom of your bucket, you have a few more moments to add some of your pearls, things that have happened here that you don't want to forget. Hey, welcome back, everyone. So it's right about 11 o'clock. We're going to take our next break right around 12:15-ish. And I'm just wondering right at this moment, what is on your mind, burning questions, anything that you want to bring forward before we continue this journey?
Hi, Steven.
Yes,
Can you
Destiny.
hear? This is Kathy.
Oh,
Can you hear
excuse
me?
me. Yes, I can, Kathy.
Thank you. And sorry, I don't have a webcam, so I can't join you face to face. But I was just thinking, this approach sounds good for my teenager when dealing with. I mean, sounds like it might help me on a personal level.
Yeah. Yeah, interesting is that, this is a way of communicating with anybody.
Yeah.
And very helpful in bringing MI into our conversations with loved ones. And there's also something tricky in that when we use motivational interviewing with a loved one, for example, if I want my daughter to clean her room, I probably won't use motivational interviewing in that situation, because in motivational interviewing, I have to be very aware of what my personal interests are and what I'm emotionally invested in people doing or not doing. And of course, with family, we are personally invested. And in the case of clients, I care about them too, but there's a different kind of investment. And part of the potency of motivational interviewing is at the end of the day, like I said earlier, of walking away from that conversation, of letting go. Because I can't control that person. That person has their own destiny. They're going to make their own decisions and choices. And in the end, I do my best and I have to let go. So when it comes to loved ones, it's that, so many of the communication skills of motivational interviewing are very effective. And if I do this to get somebody to do something who I care about and love, it's no longer motivational interviewing. So there's quite a bit of subtlety there. And Kathy, thank you for bringing that question, that comment forward. Destiny, I can see your hands up.
Yes, I was like, oh my gosh, this hammer that keep on my back pocket every 2 seconds. I'm like, oh my goodness, I need to. Most recently, there's just been like 2 clients I can automatically think, okay, I need to need to redo my approach, because I'm like, okay, this is the agreement. The agreement's not being met. So then the hammer comes out. I'm like, well, the agreement says this is what it's supposed to. I mean, I don't, so, I mean, I can still say, you know, there are times like principle, this is what we got to do, have that directive kind of approach, but then the more of when they're working towards those goals of self-sustainability, instead of me being like, oh my gosh, I see this, right. I know you like treatment, like that'd be super helpful, but kind of not doing the hammer. It's more, I can't, autonomy. That's your decision. And it's not, and if it was to be something that I heavily like persuaded, if it were to fall through in any type of way, it's, oh, you made me do this. This was you. And there's no accountability in terms of they came to that decision. So, I'm already just working through everything that it's perfect.
Well, Destiny, you know, thank you for bringing your voice forward, because you're just speaking about something that is so important in this way of working. And it's hard to put the hammer away because we're used to that approach. And most of us are used to it because we don't know what else to do. The tools that I'm sharing with you is another approach. It's something else you can do. And what we know is that an approach like motivational interviewing takes the burden off of my shoulders, where I don't feel the same pressure. I can relax a little bit more. And what we know from the evidence is that this way of working works better, a lot better. And it's a skill. It takes practice. And the good thing is we're together today to start practicing some of these skills. I'm going to move to my next slide. A quote: when deprived of choice, the only freedom left is the freedom to say no. An important principle in motivational interviewing, a key principle, is this whole notion of choice and autonomy and self-determination. So before we move on, I wanted to return to your comfort in role playing. If you could look at the front cover of your handout packet, please. And you all circled a number corresponding to your comfort, and I'm putting that back up on the big screen in terms of the poll. We got quite a spectrum. The number that's most represented is the number 2. And like I said earlier, before I'd even consider real playing with you all, it's so important for me to hear from some of you. So I've got a few questions, and I'm wondering if one of you who picked one of the numbers in the middle, like a 4, 5, or a 6, if one of you might be willing to tell me about your number and raise your blue virtual hand, I'll call on you. I'd love to hear from you. A 4, 5, or a 6. Haley, thank you. Thank you.
So I actually put more than that. If that, sorry, I might have
That's okay. What
misunderstood,
number did you
but,
pick, Haley? What number?
Probably like an 8 or so.
And how come?
I feel comfortable role playing. For me, it's a really helpful skill because it's a way to take something that I've learned and to see if it's actually resonated. So I'm comfortable with it for that reason. Of course, the online platform is uncomfortable for a lot of folks, myself included, but I'm willing to give it a shot.
All right. So you picked an 8, and you recognize that this online remote platform inherently makes it uncomfortable. I'm uncomfortable because of that. And most importantly, you're willing to give it a shot. You're willing to do it because you recognize that that is such an essential way of learning,
The
especially,
online, I'm sorry, quick question.
yes.
When you're doing it, it's just you and the other person in a break off room, so no one's watching you do it with the other person?
Exactly. It's just one-on-one. Except, of course, right now, Kat, you and I are role playing right now, and everyone is witnessing this, which, by the way, you and Haley have done a great job of so far. Thank you.
I'm at a 10. I think it's so fun.
You're a 10?
Yeah.
So you actually weren't a 10 at the beginning, I'm
No,
assuming.
I was, and I
Oh,
still am, but
oh,
I
you
didn't.
still
I
are.
I didn't get a chance to vote at the last time.
Okay. So tell me about a 10.
Oh,
How come a 10?
I just think it's fun and really useful.
Yeah. So you recognize how valuable real playing and practicing in our Zoom room classroom is going to be very helpful in becoming skillful in MI. Kat, thank you. Now, I'm wondering if one of you who picked a 1, 2, or a 3 might be willing to bring your voice forward. Now, before you do, I really want to honor and recognize all of you that picked one of the numbers down here. Not that I don't appreciate where you all are, I do. I just want to especially honor you all for putting yourself on the lower end of the limb. This is so important for me to know. And I'd love to hear from one of you, a 1, 2, or a 3. I know that most of you picked 2s. I'm ready. Oh, Rhiannon, you picked what number?
I picked a 3, and honestly, today it's because I'm sleep deprived and my brain is foggy. Normally, I would probably be a 5 or a 6 because I do think it's the best way to learn a skill like this.
Yeah.
But having not slept very well all week, I'm just foggy headed. And so that's why I chose a 3.
Yeah, you're fried. You're not at your best.
Yeah.
And under normal circumstances, you'd be higher on the scale because you're good to go with real playing. Rhiannon, thank you very much. I wonder if another person who picked a 1 or a 2 might be willing to tell me about your number. How come you picked a 1 or a 2? Kathy, yes. What number did you pick, Kathy?
I picked a 3, but I was leaning between a 2 or a 3. And I actually picked that because I thought it was going to be observed. And for some reason, when I'm actually a one-on-one interacting with somebody, I really feel comfortable. But anytime I'm being observed, I'm an insecure about that. I don't know why.
Yeah. So, quite naturally, you don't want to be watched. And you don't want to feel like you're under the microscope. Yeah.
Exactly.
Yeah.
When I feel that way, I tend to second guess myself. I don't, things that would normally come more naturally for me just don't. I feel like, I'm being judged or something.
Yeah. And nobody wants to be judged. You don't want to be judged. And that's why you are kind of in between a 2 or a 3. Yeah. And Kathy, could I ask you a few more questions about your number?
Sure. Yeah.
So when I asked you this question initially, how come you didn't pick a 0?
Because for the most part, I think that I'm a good listener, and I do like interacting with people, especially in a one-on-one setting. So that's why I chose the 3 in that area.
Yeah.
But I think sometimes my second guessing myself and my own little quirks have put me lower on the scale.
Yeah. So, you like working with people and you
Yes.
like listening, and that's something you bring into your conversations, and that's the reason that you didn't pick a really low number. Now, another question, what if anything might you need from me that
Well,
would leave you feeling more comfortable, like a 5 or a 6 or a 7, anything you need from me or the group for that matter?
I think already I've learned in this short time that we've already had together. I mean,
Uh-huh.
because I've never had any interviewing training.
Uh-huh.
Um, so there's a lot that I could learn here today that would maybe help me feel more confident in my ability to best help somebody.
Uh-huh. Yeah.
So,
Yeah. Kathy, you're all about learning. You want to improve. And
yes.
the good news is you've already picked up some tips in our short time together. And I can imagine that you're looking forward to some more learnings also before we arrive at 1:30.
I am,
Yeah.
and thank you.
Yeah, you're very welcome. And I just want to recognize you and the other voices for stepping forward. You're actually role playing with me right now. And you are being observed, those of you that just spoke, and you're doing it in a very graceful and natural and authentic way. I want to let all of you know that in a training like this, staying in alignment with motivational interviewing, it's always your choice in terms of how to participate. And when I do move you into breakout rooms, you're going to have a choice on what role to play, either as the interviewer or as the person playing themselves and being interviewed. So you have a place of choice right when we get to that moment. Oh, something interesting is happening right now. And Steve has just stepped aside. And who is speaking right now? This is Malcolm. Now, Steve was just modeling some really important things as he was engaging some of you in a conversation about real playing and your comfort. And so curious, what did you just witness Steve doing and modeling? What what did Steve do or say that you thought was helpful? And if you'd be willing to place in your chat some of the things that, oh, so you can place in your chat, and Haley, you have your hand up, and I wonder if you could give voice to what you witnessed.
Well, really, Steve was just exhibiting motivational interviewing. I liked how you said, hey, you were at a 3, why not a 0? Steve was reflecting back to the folks some of their concerns that they had while also affirming people as well.
Mm-hmm. So, you know, you picked it up clear as a bell. Steve was modeling motivational interviewing, and Steve was demonstrating and modeling some real important aspects and principles and skills and pieces of MI. And some of the specific things that some of you noticed, the reflective listening, the empathy, the asking permission, exploring, and validating concerns, and supporting you all in feeling more at ease. So, just so you know, Steve's primary job with all of you today is to walk the talk, to live and breathe motivational interviewing. Everything that Steve does is going to be in the spirit of MI. It's always very intentional. Motivational interviewing is also a way of teaching and training. Out of the corner of one eye, pay close attention to how Steve works with you, because everything that Steve does is very intentional. It's based in motivational interviewing. So keep track of those things. Charlie Parker, famous jazz musician, always said that if you don't live it, it won't come out of your horn. If you don't live it, it won't come out of your horn. Steve's job with you all is to live motivational interviewing so that it comes out of his horn. All right, it's me again. So thank you for letting me know where you're all coming from in terms of real playing and the possibility of that happening. I'd like to bring forward right now my teachers. And on the left-hand side, that's Steve Rolnick, who currently lives in Cardiff, Wales, originally from Cape Town, South Africa. And on the right-hand side is Bill Miller, who currently lives in New Mexico. They're the co-authors of the classic books about motivational interviewing. And what you're looking at right now is the third edition of the original book that I showed you from 1991. This is what Bill and Steve say about motivational interviewing. They said this 11 years ago. In some ways, MI is simple, but mastering it is neither quick nor easy. And that is the truth. On the surface, this way of working seems pretty basic. It's pretty accessible. And I'll just tell you, the deeper you get into this, you're going to recognize this is really an art form. That does take a lot of practice. Bill Miller said 12 years ago, developing proficiency in MI is like learning to play a musical instrument. Some initial instruction is helpful, but real skill develops over time with practice, ideally with feedback and consultation from knowledgeable others. As with other complex skills, gaining proficiency in MI is a lifelong process. My deepest hope for you all is that our time together be a really important step in your lifelong process in developing this skill, this ability. MI is like learning to play, it's like learning a foreign language. And you just don't go to one workshop and become fluent. To become fluent, you got to stay with it and you got to practice. Now, from my experience, a really important first step on the journey in becoming proficient in motivational interviewing is to embrace a concept that I like to call get real. And you're going to see get real on the front page of your handout packet. And this is what I mean by get real. My goodness, when I'm working with somebody, first step is this. I got to get real with them. I have to be authentic. I have to be a real human being. I can't be a phony baloney. What you see is what you get. I am transparent. I speak the truth. I am not better than you. I sit at the same level for you. I am myself. I don't stand behind my expertise, my degrees, what I know. I get real with people. Contained in get real are four very important ingredients. Here's the first ingredient. First ingredient in getting real is respect and dignity. In this way of working, I honor the humanity of every person. I honor every person's capability in making change and moving in a positive direction. I honor every person's self-determination, autonomy, and freedom to make their own decisions and choices. In this way of working, I treat every person as if they're an honored guest in my own living room. Respect Second ingredient of getting real is empathy. As I mentioned earlier, we know from years and years of research in many different fields that people are more likely to make change in conversations when they feel understood. When people feel understood accurately, it's a game changer. Third ingredient of getting real is active collaboration. We know that people are more likely to make change when they're treated as an expert. We know that people are more likely to make change when they're honored for the wisdom that they have. People are more likely to make change when we encourage that person to do most of the talking and exploring. I don't want to be a unidimensional information delivery system where I'm bombarding people and telling and selling and shaming and pushing and confronting and dictating. No, I sit side by side, I collaborate, and I partner with people. Fourth ingredient of getting real is to listen, and listen some more. The primary communication skill that motivational interviewing is grounded in is the skill of active, empathic listening. And I'd like to do something right now to start warming up our listening muscles. In your handout packet, if you all could turn to page 3, please. Page 3. You're all going to have a chance in just a moment to meet with a partner in a breakout room. Excuse me, I'm going to cough, so I'm going to mute myself. You're going to be meeting up with a partner in a breakout room. When you enter that breakout room, you're going to decide who's going to be the interviewer and who is going to be the interviewee. The person who's playing themselves is going to be asked this open-ended question. During this time of the pandemic, in what positive ways are you coping and caring for yourself? When you're asked this question, you're not role playing, you're real playing, you're being yourself, and you're talking authentically and normally and naturally and allowing your interviewer to guide the conversation. When you're playing yourself, your job is not to make things difficult for your interviewer, to not go out of your way to give them a hard time. Now, if that's who you are normally, we can't do anything about that. I just don't want you to go out of your way to make things really tough on them, because we always want to support the interviewers and having a chance to practice. So that's what the person playing themselves is going to do. So the interviewer has these 4 steps on page 3. And they're going to ask this open-ended question. And after they ask this open-ended question, symbolically, the interviewer is going to sit on their hands. They're going to bite their tongue, so to speak. They're going to leave the hammer on the upper shelf. And over the course of 4 minutes or so, there's going to be no fixing from the interviewer, no education, no problem solving, no skill building, goal setting or action planning, no confronting, pressuring, convincing, arguing, telling, directing, taking charge, arguing, coaxing, probing, shaming, persuading, moralizing, lecturing, analyzing, warning, interpreting, moving too quickly, advising, sharing your opinion, or talking too much. That is a mouthful. So I got to tell you something. The last in-person training I did was during the first week of March. I was either in Oklahoma City or Tulsa. I'm not remembering which place I was, but I was in your home state the first week of March. Last in-person training I did. And I read through these ingredients of fixing. And after I did it, somebody in the room raised their hand and I said, yes. And they said, excuse me? So what do I do then? And this person was playing with me. And what you're going to do is what you see on page 4. You're going to ask this open-ended question. And then after you ask the question, you're just going to listen. Listening is much more than being silent. It is a very active process. And what makes it active is me allowing a lot of silence. And when I bring my voice into the conversation, one thing that I do is I bring forward what we call encouragers, which are like little puffs of wind that let the other person know, I hear what you're saying, I'm curious, and I want you to tell me more. And we know what encouragers sound like because we know linguistically all languages inherently have encourage. Aha, right, interesting. No, really. Oh, you don't say, aha, right. No, shut up, for real. And you know what I'm doing because it's naturally what we do when we're with a good friend. So interviewers allow those little puffs of wind to support movement in the conversation. There's one encourager we use frequently in motivational interviewing, and it generally sounds like, tell me more. So what classically happens, we ask an open-ended question and we listen for a bit, and then the interviewee is staring at the interviewer and you both don't know what to do. What you can do right at that moment, interviewers, is to say, tell me more. Because usually there's more for that partner to give voice to. And last but not least, you're going to hold up little mirrors and you're going to reflect back what you just heard the person tell you. We're going to do a lot of focusing on reflective listening after this activity. So you may not quite know how to do this or what this means, but just so you know, the act of holding up little mirrors is potent. And last but not least, we know historically, cross-culturally, the primary means by which we truly inspire and motivate another person originates with my presence. A presence that is very calm and relaxed and curious and even-keeled and steady and non-agitated. A presence that is not trying to make something happen, not trying to get somebody to do something. It's a presence that is extending a compassionate neutrality and extending a benevolent witnessing of the other person. Listening with acceptance and curiosity, and listening with all of one's senses, eyes, ears, and heart. Listening with your bones. So, interviewer asks the question, they step right into this powerful listening mode, and they're going to be in this place for several minutes. And then there is step 3. And step 3 is the moment where you're going to hold up a big mirror, and you're going to summarize the pearls. The most important things you just heard that person tell you. Most important things. You're going to summarize those pearls, the gold pearls. And at the end of your summary, you're going to say, hey, did I get it all? Or even better, an open-ended question, what, if anything, did I miss? And as an interviewer, if it's clear that you get it, then you're going to cut right to the close and you're going to thank your partner. You're going to be in your breakout room for 5 whole minutes. You may not need 5 minutes. And if you finish early, you can just chit chat with your partner, or you can return to the main room where I'm going to be. So you can do that. You'll be receiving some messages from me in your breakout room to support what's happening. And when there's 1 minute left, you'll receive a countdown to let you know that you're moving into the final 5 minutes. So what do you think? I did a lot of explaining here because in our first breakout, I want to make sure we're very clear. What questions, if any, do you have right at this moment about what's going to happen? You're not going to switch roles. You're just going to do it one way, one interviewer, one interviewee. Haley, yes.
I always have questions, y'all. So I think I might have missed this part. How do we know who is the interviewer and the interviewee?
Yeah, so when I move you into your breakout room, you'll click a button that says join, and then you'll be there with your partner. And you'll say hi. If you don't know this person, you can introduce yourselves and then make a decision between you two on who's going to be who.
Awesome.
Yeah, pretty simple. And, you know, there's a mystery to Zoom. You know, I've done this enough times now that sometimes some people don't end up in a breakout room for one reason or another. If that happens, you're going to be with me in the main room and we'll be doing something else. If for some reason your partner in your breakout room doesn't join, stay there for a solid minute to give them a chance to join. And if they don't join, exit the room and come back to the main Zoom room with me. Now, I'm feeling inclined right now to model this briefly, just very briefly. I'd just like to take 1 minute. Would somebody be willing to allow me to ask you this open-ended question so I could show everyone what it looks like? Kimberly, thank you. If you could unmute yourself, please. Kimberly, you got yourself muted still. There you go. Hi, Kimberly.
Okay. Hi, Steve.
Hi, good. Kimberly, can I ask you this question?
Yes, sir.
And thank you for volunteering. During this time of the pandemic, in what positive ways are you coping and caring for yourself?
I have actually set up more appointments with my therapist during this time to do some self-reflection, to help in knowing when I'm starting to wear myself out. So taking some time of just meditating even. Of being grateful for some of the things that I'm normally not grateful for, but I'm counting them today as blessings because there's a lot of weight that we're carrying on our shoulders during this time.
Man, the weight is heavy.
Yes.
And you're taking care of yourself. One thing is that you're seeking additional support. You've got the meditation that you've been doing to take care of yourself and just trying to keep things in perspective. Yeah.
Absolutely.
Tell me more. What else, Kimberly?
Well, a lot of this is heavy on us all, and I'm finding that I've had a lot of people come to me even in what to do during this time. So sometimes just getting out and exercising, like walking and just some outdoors kind of environment
Getting
really
outside.
helps.
Getting outside, moving the body, help shift perspective, see things in different ways. Yeah. So Kimberly, let me see if I got the big picture. And you're clearly doing some things to keep yourself stable and to keep yourself strong and resilient during this incredibly challenging time. Getting outside, getting exercise, breathing, meditation, getting additional support. So how am I doing? What, if anything, did I miss?
I don't know. I think I'm more focused. Like I'm really having to mindfully do things. And usually I can do things kind of just in autopilot.
Right.
And through this pandemic, one of the things is this right here, mindfully having my mask, mindfully being safe when I leave a public place to wash my hands,
Right.
It's a big thing. I don't usually have to be so mindful in my life on a daily basis, but this pandemic has caused that to be something really having to focus more and be aware.
Yeah, you got to be on your toes.
Mm-hmm.
You got to be sharp. You got to be paying attention.
Yes.
And that also takes energy. And it's something that you're very conscious in doing.
Yes.
Kimberly, thank you so very much for allowing me to listen to you and to hear your story about how you're taking care of yourself.
Absolutely,
it's been an honor.
Steve. Thank
It's
you
been an
for
honor.
listening.
Hey, so that's essentially what you interviewers are going to be doing. And what I'm going to start doing right now behind the scenes is I'm going to set up your breakout rooms. And I'm going to be silent for about 1 minute while I'm doing some behind the scenes stuff. I'll be back to you really quick here. And Sasha, just so you know, if you could actually join the breakout room I'm going to assign you to, which will support everyone in having a partner. And I'm assuming you hear that and you're good to go with it. So we're all set up here, and I'll see you all again in 5 minutes. And if you do finish early, you can return to the main room with me. If you need assistance, you can invite me to join your breakout room briefly, which I'm always happy to do. All right, enjoy.
Hello.
Hi, April. How are you?
I apologize. I'm good. Well, I have this child here, so he may yell. So how are you today?
Good. Been looking forward to this session.
Yeah, I actually got on yesterday because at first they were like, we don't have space, and then I guess some people dropped out, so they're like, just kidding. So it worked out. Would you be open to being the interviewer, or do you have a preference?
I'm happy to be the interviewer. So, April, tell me, during this time of the pandemic, what positive ways are you coping and caring for yourself?
I guess one of the main things is I'm not getting caught up in the news because I know A, it's forever changing, so it's very confusing, and then B, it tends to have a negative connotation put on it, and that can be overwhelming. So I'm just practicing, I'm applying safe practices, but not allowing myself to live in that constant state of worrying, because I'm kind of an it is what it is type person. So I'm not gonna I'm not gonna purposely freak myself out by doing all of that.
Yeah. Sounds like you're giving yourself some space away from the news and its craziness during these times, and trying not to get super wrapped up in the negativity.
Yeah, definitely. Because it's interesting because you have, some people in your life that are completely like, I'm not stepping foot outside my house. Don't even look at me. I might get COVID. And then you have other people who are like, I'm not wearing a mask. You can't tell me what to do. So it's interesting seeing the variance of people and trying to kind of find where you stand in the whole thing. Like, what do you want to do? And then, human decency. And even if you don't agree with something, doesn't mean you don't do it just because it makes other people feel comfortable. So it's, and then that on top of, COVID is just one of the issues of 2020 right now. So it's like, it's just, a lot at once. So trying to limit my exposure to all that as much as possible. Cause I feel like when you're the type of person who, does care for others and want to help others and have empathy and all that, it's easy to get that to get overwhelmed by everybody else's struggles and all of that good stuff. And it's just like being a little selfish this year, I guess, and being like, okay, you know, I love you, but I'm gonna have to, you know, cut that off before it turns into something worse.
Yeah, and setting those boundaries so that you're able to be yourself and to be the helping person that, you know, you want to be, and to be engaged, and where it's so hard to figure out where to fall on the spectrum of COVID and how to react and deal with all the different conflicting information that we're receiving, right?
Yeah, definitely. Because I mean, yeah, it's like one person says it's, you know, the end of the world, the next person says it's not as bad as they say, and I'm like, what? I just want to know what the truth is. That's all I'm asking. Like, what is the actual truth? Because it's like 1 minute there's a video that says, hold on, okay, there's a video that's like, oh, this is the cure, and then 2 seconds later that video has been debunked, and I'm like, okay, I just want to know what the actual truth is. Like all this conspiracy theory and Democrats versus Republicans. I'm like, why is everything becoming? I'm sorry, I'm about to go on a rant, but I'm like, why is everything being politicized? This should not be a political thing. This is people's lives. So I don't know. It's just, this has been a very interesting year, to say the least.
Yeah, it's hard to separate what's fact from fiction, and to keep up with, you know, this, with the emerging situation. Like on some level everyone's trying to figure out what this is, but on the other hand, like there's so many people who are getting up there and saying this is what it is, and then the next day it's no, just kidding, no it's not.
Yeah, it's literally just kidding. I'm like, okay. But yeah.
Where do you fall in terms of your own personal, like where have you decided what's the truth for you?
That's a hard one. I guess for me it's like I'm not crazy enough to think that it doesn't exist, but I'm just like, I will wear masks and wash my hands and all of that, but I'm still trying to just be normal as much as possible, but like avoiding, you know, spreading anything or like that. Sorry, I know it's wrapping up, so I'll stop talking now.
Thank you.
Yeah. Oh, sorry. Thank you.
Thank you for
this
sharing.
Is great. Thank you for listening to my craziness.
Not craziness at all. We're all in the same boat.
It sounds like you're doing your it sounds like you're doing your bike rides and getting out in nature and breathing fresh air, and then taking your naps, your brief naps in the afternoon. That's really great.
You now ask me, am I getting it all?
What do you mean by getting it
Well,
all?
just say, because you just offered me a summary and then asked me, hey, Steve, do I understand or did I get it all?
All right. So was that what I understood you to say?
You know, you understood me exactly. So Pam, step 4, I'm ready for some gratitude right now.
Did I miss anything?
No, you didn't.
All right. Well, it sounds like you've shared a lot with me, and thank you so much for your time today.
Oh, it's been an honor. And thank you so very much. And you may not realize this, Pam, but these last few moments, everybody in our classroom witnessed what just happened.
Wonderful.
And yeah, wonderful. And you modeled it beautifully. You really did. So welcome back to all of you. Yeah, hey, let's give roller coaster hands right now to Pam. Yep. Thank you, Pam. So you've all had a chance, or at least most of you had a chance, to either be an interviewer or an interviewee. And I've got a question to ask the interviewers, those of you that were the interviewers, like Pam. Are you open right now to receiving some feedback? And if you are open to receiving it, if you could give me a thumbs up virtually or in your video box. If you don't want to receive feedback, you don't need to. And you can mute yourself for the next few moments. So, interviewers, who's going to offer you some feedback right now are all of the people who were being interviewed. Speakers, interviewees. What did your interviewer do a great job of while listening to you? And if you'd be willing to briefly respond to this open-ended question in your chat, what did your interviewer do a great job of? So I want to prepare you interviewers. You're going to get affirmed here. You're going to receive some validation, some honoring, and I'm going to give voice to what interviewers did a great job of. Flexible, enthusiastic, excellent rapport building skills, great listening, showing respect, authentic, reflected back, and identified with the struggles I was sharing, maintained eye contact, reiterated, reflected what I was saying, extremely affirming, listen to my random rant, friendly, respectful, open, and kind. Wow, interviewers, you are walking in the essence of motivational interviewing. Somebody just placed in their box, transparent. Now, I got a question for all of the interviewers. As an interviewer, what did you learn from this activity? Not what you learned from your partner, but as an interviewer, what did you learn about motivational interviewing? What did you learn about listening? What did you learn from this activity? And you got a choice here. You could raise your hand and you could bring your voice verbally forward, or you could respond to this question in your chat. What did you learn? Austin, thank you for raising your hand. What did you learn?
You know, just like that quote that you put up a while ago, that it's simple, it's not extremely difficult concepts to grasp, to use MI.
Yeah.
And so just it's those small things, asking that open-ended question and like, how are you seeing it? And that's what gets the clients engaged and want to move through the ambivalence.
Mm-hmm. Yeah. So it's simple. It's very simple. And there's also a lot of subtlety to this. And those of us that really know motivational interviewing, we walk in humility when it comes to this way of working, because we know that this takes so much practice and it is simple, and there's potency in the simplicity. Austin, thank you. I'm going to give voice to some of your responses in the chat. It was hard not to give advice. I actually did it once at the end. Oh, it is so hard. That reflex, that writing reflex to step forward and to provide something is so strong within us. And part of becoming proficient in MI is recognizing that reflex and managing it. I learned that listening really helped me feel connected. It felt good. You get more information from people than when you ask questions. Oh, that is a key concept. Man, I put myself in my partner's shoes and I listened, making sure I summarized to show that I heard exactly what was said. All right, lots of learnings. Now, I want to tell you why we did this simple activity. And we did it for a couple reasons. One reason is that we know cross-culturally, across all demographics, there are common human reactions to being listened to. And this is what happens when we're listened to. When we're listened to, when people are listened to, they're more likely to move in a positive direction. Another reason we did this activity, the way we listen affects the quality of our assessments, our decision-making, our education, our advice, and of course, our counseling. Another reason that we did what we did is all about what we're going to call the gold pearl. And this is what I mean by the gold pearl. We know, we've learned, we know from the evidence what the most important things I can bring into a conversation with somebody that is going to make the biggest difference on whether or not this person moves in a positive direction. We know what that gold pearl is, and we also know what it's not. And it's not my education, it's not my advocacy, it's not my advice, it's not my feedback, it's not my analysis, it's not my interpretation, it's not my referral, it's not me reshaping somebody's cognitions, it's not me holding their hand. Now, all of those things I very well may do in any interaction with somebody, and they may have their place in any interview. And those things are not the gold pearl. And this is what the gold pearl sounds like. You know what makes the biggest difference on whether or not somebody makes change and moves in a positive direction in a conversation? It is all about my underlying attitude, my tone, my presence, my mindset, my heart, my orientation, my interpersonal style, the spirit that I embody. In your handout packet, please turn to page 4. Page 4 is a summary of the key ingredients of a motivation enhancing interpersonal style and spirit. In other words, the key ingredients of the gold pearl. If you could take 1 minute on your own, and I'm going to invite you all to read every word on page 4. And I'll come back to you in 1 minute. Every word. I'm wondering what questions, comments, reactions do you have to anything you just read on page 4? Destiny, yes.
So I was going through everything and I was seeing, you know, we talk to them, we feel, we be authentic. And but I was trying to wonder like when do we go into like goal setting or skill building? Because that's in the no fixing. But
Yes.
so it's in that permission part we can like if we
Right.
see something, we can ask permission if they're like wanting to work on that or wanting to get advice, right?
Yeah.
Yeah,
So
okay.
we're going to touch on that, Destiny, before we wrap up. And a short answer for me right now, when the person is ready. And we'll address that later. These are the key ingredients of a motivation enhancing interpersonal style. Motivational interviewing cannot be done without these key ingredients. Your motivational interviewing is empty when these ingredients are not in place. We always say in motivational interviewing that style and spirit is everything. This is the backbone of this way of working. From my experience, a lot of helping professionals are really good at doing what they're supposed to do. They're really good at playing the right notes. They're really good at asking the right questions, doing the right assessments, giving the right information, and so forth. Just because you're playing the right notes does not mean you're playing the music. Motivation for change arises from the music. We know that motivation for change primarily arises in the context of a relationship with another person. There's the Superman way of change, where he steps into a closet and he steps out of the closet transformed and changed. That's not how change works for people. Change arises not in a vacuum, not in a closet, not behind closed doors. It usually arises in the context of a connection with another person, in a relationship. And these are the key ingredients that support this kind of relationship in being potent. In MI, we have a primary belief that we operate from. It's a core conviction. And the belief is the capacity and potential for change and adherence is within every person I encounter. This is a hope-based belief. MI is a classic strength-based orientation. Sometimes we call this the Michelangelo belief. You may know the story about Michelangelo. After he created the masterpiece David, he was asked, well, how did you create David? And as the story goes, Michelangelo said, well, I didn't create David. David was in the block of stone from the beginning. And my job was to liberate that potential, to call forth the masterpiece that I already know was there. So our motivational interviewing sometimes is similar. I'm working with people and they look like a block of stone. And I'm thinking, where's the change? Where's the possibility? Where's the hope? And I'm always holding that belief that it's in there someplace. And my job is, how can I call forth that seed of potential that is already within this person? Kimberly just placed in the chat, change doesn't happen overnight. It may not happen in the first conversation we have with people either. So true. MI is a journey. And the way change unfolds in people is different. In some people, it does unfold and is activated in one conversation. In other people, as you all know, it's a journey. And that's normal, and we stay the course. Jaime Escalante, the high school teacher from Los Angeles, who the movie Stand and Deliver is based on, he operated from a strength-based orientation. And here's a classic quote of his: you can't be a good teacher, you can't be an effective helping professional unless you see the potential in every person. So I'm going to bring forward something called the 149 principle. The 149 principle. If you could take a close look at everything you see on the screen, and I'm wondering what stands out to you. What's the first thing you notice when you look at the 149 principle? What do you notice? If you could quickly place it in your chat. What do you see up here? What's obvious? What do you notice? Okay, 4 times 4 is not 15. So this is human nature. We tend to turn our attention immediately on what's not working, on the problem, on the wrong answer, on the pathology, on the bad behavior, what needs to change. Part of becoming proficient in MI is changing my focus. And in motivational interviewing, we turn our attention in the direction of the other person's strengths. What is right? What is working? In the direction of the resiliency and the past successes and the hopes and the dreams and the visions and the aspirations. In MI, we draw out, we uncover strengths, and those that we serve have lots of gold pearls. There's a lot within them. And my job in a motivational interview is to call forth these pearls and support them in coming to the surface. During this time of the pandemic, in what positive ways are you coping and caring for yourself? Now, this is an open-ended question. And in MI, it's what we would call a strength-based open-ended question. Because in a motivational interview, my initial and primary focus is on the strengths in the other person, So for example, here's some examples of strength-based open-ended questions. I'm going to read the questions in black print, and I wonder if one of you could alternate with me and read the questions that are in blue print, and I'll wait for that blue virtual hand. Who could read the ones in blue? Kathy, thank you very much. So just rotate with me. What personal strengths do you have that have supported you in surviving on the streets?
And I read the blue, right?
Yes.
What positive steps have you taken in the past week to keep your apartment clean and tidy?
What, if anything, do you like about school?
What are you currently doing to get along better with your roommate?
What are the main things you're doing to support your overall health and well-being?
What successes, even little ones, have you had since our last meeting?
Kathy, thank you. These are simple examples of what we call strength-based open-ended questions. Kinds of questions you want to have in your back pocket. You don't want to have to think about asking questions like this. They're questions that you naturally ask people. Now, here we have our 45-year-old male client, and I'm wondering if you were meeting with them and you had 5 minutes, one 5-minute conversation, what would be an example of a strength-based open-ended question, that you might ask him and place it in your chat? What would be a strength-based open-ended question that you would ask him? So I'm going to start giving voice to some of your questions. So what are some good parenting tools you use with your son? What do you enjoy about being a dad? What do you like doing with your boy when you spend those precious weekends with him? I can see that you served in the Gulf War. First off, thank you for your service. And I wonder, what did you learn by being of service that you are bringing into your life right now? So I'm wondering, you've been through a lot. You've had a lot of hard things come your way. What are you doing to keep your head above water? What are you doing right now to support your health and well-being? Those are examples of strength-based, open-ended questions. What do you love about going on that hunting trip every year? What do you love about going on that hunting trip? What do you most look forward to? So these are all strength-based, open-ended questions. Now, motivational interviewing puts the person, the client, behind the steering wheel. And at the same time, I'm the one who is guiding the conversation. We have 5 communication skills that we use to guide our conversations. ORS plus I, open questions, affirmations, reflective listening, summarizing, and information that we might offer. So we're going to spend a few minutes right now before break focused on open-ended questions, which are the opposite from closed questions. Short answer, yes or no questions. Have you been making your appointments? Or asking for facts? What is your address? Asking if they know something. Do you know where the clinic is? In motivational interviewing, we shy away from these kinds of questions. Yeah, it's important that we ask some of these questions sometimes. These are not the questions that support people in making change. And we know that these questions generally limit a client's answer options. In motivational interviewing, we lean into questions that are open-ended, that invite people to give voice to thoughts, feelings, experiences, opinions, values, and motivations. I'm going to bring forward some polling questions to see where we're starting with open-ended questions. Which of these is an open-ended question? Do you think that's a good idea? What do you think about that idea? A few more seconds. And you all accurately identified the open-ended question. What do you think about that idea? Let's do another polling question related to open-ended questions. Unfortunately, there's construction going outside my window right now, so you might hear some sawing. Sorry about that. Which of these is an open-ended question? What concerns, if any, do you have with your drinking? Do you have any concerns with your drinking? All right, and we're all in the same place. Here's the open-ended question. What concerns, if any, do you have with your drinking? One more. Which of these is an open-ended question? Do you have any questions? What questions do you have? And here's the open-ended question. What questions do you have? And you might be thinking, well, what is the big deal? Do you have any questions? Versus what questions do you have? And what's interesting, I'm just closing my windows here. What's interesting is that the human brain tends to respond differently to open questions versus closed questions. Open questions don't guarantee that people are going to speak. What they do is they increase the chances. They increase the odds. And when we're working with people, we want to increase the odds that clients start to speak in certain ways, Now, there's a bunch of questions on your screen, and I'm going to bring forward motivational interviewing sign language for closed questions and open questions. Closed questions are sign languages, two fists, Open-ended questions, ah. So if you could join me right now with the closed-ended questions, and now open-ended questions, ah. So I'm going to read each of these questions in the moment. If you could quickly identify what kind of question it is by either doing this or this. So really bring your body and your voice into it. Make this alive somatically. Do you smoke marijuana? Tell me about your drug use. Do you have any concerns about not going to school? Isn't it important for you to successfully complete your probation? As you see it, what might be some of the benefits in moving back home? Do you want to be successful in life? If you were to quit, how might that be a good thing? Do you think you're going to get your act together? Have you ever thought about getting your GED? You use again, you go to jail. Is that what you want? What concerns, if any, do you have about your gang life? Before we get started, what questions do you have? What was your life like before you started selling drugs? Have you been going to the anger management class? Can you tell me more? Can you tell me more? Now, some of you might be thinking, well, what is the big deal? Can you tell me more? How would you make that open-ended? Tell me more. And the reason why we want to lean into the open-ended version, again, it increases the odds that people will speak. Now, I noticed that some of you weren't bringing your sign language into these questions, and that's cool. And I'll tell you why we're doing this. Most helping professionals, when they're asked, well, what kind of questions do you mostly ask people? And what we say is, oh, I mostly ask people open-ended questions. When most helping professionals are observed, what we see is that 70% or more of the questions we ask are close-ended. And we want to change that. We want to ask a lot more open-ended questions because it's those questions that tend to guide conversations towards change. So an important step in becoming skillful in MI is recognizing which questions are which. When we're learning MI, at least half of the questions that I ask ideally are open-ended. So we have our MI sign language. Open questions, closed questions, So I've got a simple interview here and need 2 volunteers to bring it alive. Need an interviewer and a client. Interviewer and a client. And I'll wait for those blue hands. Raquel, you're the interviewer. Janelle, you're the client. The rest of you, your job is to bring your MI sign language into this interview. Whenever you hear, witness an open-ended question, close-ended question. All right, interviewer, you're on.
Hi, you're here to talk about gambling, is that right?
Yes, I am.
Do you think you gamble too much?
Probably.
What is your favorite game?
Craps.
Do you usually drink when you gamble?
Yeah, I do usually.
Have you ever gone seriously into debt because of gambling?
Once or twice, yes.
How far into debt?
I had to borrow $2,000 to pay off debt.
Are you going to school?
No.
When did you drop out?
Last year.
Thank you. If both of you could stay unmuted, I'm going to have you read another scenario. Hey, here we have an interview that is all closed-ended questions. There was one open-ended question. And this is not an interview, this is an interrogation. So here's an alternative. Same interviewer, same client, and please bring your MI sign language into this interview, the rest of you. Interviewer, you're on.
kind of troubles, if any, has gambling caused you?
One obvious place is money.
In what ways has that been a concern for you?
Well, I just spend a lot of money on gambling, and I'm not always paying my bills.
Tell me about the last time that happened.
Well, just last week, I went through about $200. I start out setting a limit for myself, but then when I lose that amount, I decide to try to win it back. I've lost about $5,000 over the past 6 months. It's kind of becoming a big problem, and notice that I worry about it all the time.
Thank you to both of you. Here we have a very different interview, all open-ended questions, and you can see the interviews look different. And one of the ways they look different is that the client is speaking a lot more. And it's not that it's important that people speak a lot, it's how they speak. And the words in red are again what in MI we call change talk. Any client speech in favor of changing something that client has agreed to speak with me about. Motivational interviewing is about arranging conversations so that clients talk themselves into change based on their own values and their own interests. If you all could turn to page 8 in your handout packet once again, and on page 8 is your pearl bucket, your keeper bucket, and if you could take a few moments to reflect on your learnings, your most recent pearls, what it is that you don't want to forget, what's been helpful here, what's relevant, some ideas that you could bring into your work. Welcome back, everybody. It's 12:37. We're going to wrap up no later than 1:30. This has gone fast today. And when it goes fast like this, it's always a clue to me that you're all showing up. And I really appreciate your presence and your willingness to be engaged and open to learning about motivational interviewing. I'm going to pull up my next slide. I guide, they decide. I was doing a motivational interviewing training about a year ago, and there was a high school principal in the audience. And at the end of the training, this is Rich Ray's, he came up to me and he said, you know what? I know what my pearl is from this workshop, what my big learning is. And he said, I came up with it on my own. And here it is. I guide, they decide. And those 4 words say so much about the essence of motivational interviewing. So this may be a little hard to read, but I'm going to start. One of my motivational interviewing trainer colleagues, his name is Danny Lang. He lives in Ottawa, Quebec, Canada. And Danny, for many years, has been a street counselor in Ottawa. And several years ago, I went up there to provide MI training to his team. And one night, I spent most of the night walking the streets with him in Ottawa and observing him in his interactions with his clients living on the streets. And it was a gift to be with him, and the beauty and the grace and the dignity and the respect that he worked with people was truly inspiring. So when I got back from Ottawa a few years ago, he sent me this email and it said, I wanted to share an experience I had today while doing some outreach to a client that was living in a tent. I was asked to visit this client, a first visit, as there are a whole host of concerns about his mental health, undiagnosed PTSD, substance abuse, and physical health. I think it was a good example of how MI lives within marginalized populations. And I wanted to share it with you guys. This was with me and another colleague as we talked about this in the past. So I'm wondering if two of you could bring this interview alive. And if one of you could play the role of Danny, who is me, and somebody else play the role of the client. Who could play the role of Danny? Kat, thank you. And need a client. Amber, thank you. The rest of you, just witness how Danny navigates this interview. So Kat, you're on.
Hey John, it is Danny. Would it be okay to talk with you for 5 to 10 minutes?
Hey Danny, I'm drunk.
That's okay with me, provided it is good for you. Good with you.
Give me 1 minute. I'm sorry, I'm drunk.
You don't need to apologize. Thank you for talking with me.
You're right. I don't need to apologize because I love drinking. Come in, come in. You know, I really don't like drinking. I just need to because look where I am. Sorry for being wasted.
Thank you for your concern. However, I'm very thankful we're able to meet.
Thanks for coming to help me. So, are you the head guy?
I was asked to come by to talk to you about what may be happening up there and how we may be able to work together to make things a bit easier for you.
Good luck with that. But I'll give anything a try. Something has got to change. I guess living like this is better than swimming in the river over there.
You want something different for yourself and your dog.
I need to feel better again.
I'm wondering if you and me could meet to talk more about what might be going on for you and how things could be different.
That would be great.
Would you be willing to meet with me on Tuesday to chat at the office just over there?
Yes, definitely. Just write it down so I can remember. My girlfriend will be back soon and she will remind me.
So thank you to both of you. I'm going to stop it there. And I'd like to read what Danny said at the end of this message. About 35 minutes later, his girlfriend texted me to confirm he will be there to meet. This whole intervention took about 5 minutes max, as that is about what he could handle. While there are so many places I could have went, my hope was to guide him to consider meeting again. In this interaction, there was definitely change talk. When I see him again, we can begin to explore what is most important for him in his life today and begin to take care of some of his immediate needs. So the words in red, I don't really like drinking, but I'll give anything a try. Something has got to change. I need to feel better again. There's the change talk. Change talk usually just doesn't come out of nowhere. It arises because of how the interviewer is guiding the conversation. And that's part of the art of motivational interviewing. People change when they hear themselves talk about the need to change. And when people hear themselves speak in new ways, it has a significant impact on their thoughts, their beliefs, their attitude, and oftentimes their behavior. MI is about arranging conversations so that clients talk themselves into change based on their own values and interests. Now, if you all could turn to page 4 once again. This is the most important page in your handout packet. Style and spirit is everything. Motivation for change, classically, typically, arises in the context of a relationship. These are the key ingredients of a motivation enhancing style. We know from the evidence of all of these ingredients, the one that seems to hold the most potency, the one that is actually the most important. They're all important. There just happens to be one that rises to the top. It's empathy. It's empathy. I have a little video clip to show you that says a lot about empathy. And if you could have a watch here. if you could stand in someone else's shoes, hear what they hear, see what they see, feel what they feel, would you treat them differently? So there's always a bit of confusion about empathy and what it is and what it's not. And this is what it's not. Me having had the same experience or the same problem. It's not me identifying with people or me telling them my story or saying things like, I hear what you're saying, I get you, I feel you. It's not about being friendly or kind or solving problems for people. And it's not pitying people or feeling sorry for folks. Empathy is something really different. And yeah, it's my ability to step in the shoes of another person and to really do what I can to accurately understand their worldview, their perspective, their experience. And most importantly, it's my ability to show them that I understand. And in motivational interviewing, we show people that we understand with our reflective listening. With our reflective listening. Our sign language for reflective listening is 2 snaps. And I'm going to offer you 2 snaps, and I'm going to keep going with it. And if you could join me in these 2 snaps from where you're sitting. And the reason we're doing this is that reflective listening supports a rhythm in a conversation. It supports the flow. It supports the interview in moving in the direction of change. So I've got another interview. To bring it to life, need 2 volunteers. This is an interview between a counselor and a client named Jose. So Raquel, you're the counselor. Austin, if you could be Jose. The rest of you, your job is this. Every time you hear the counselor bring forward a reflective listening statement, please recognize it with 2 snaps of your fingers. Definitely bring your body into it. Counselor, go.
Jose, you mentioned that you shoot heroin on occasion.
Yeah, I started shooting a few weeks ago because I couldn't get high through my nose anymore.
So your drug use has gotten more serious.
Yeah, I never wanted to have to inject myself to get high, but I'm not ready to quit doing dope.
You don't like where you're headed, and at some future point, you might be ready to call it quits.
Absolutely. I don't want to turn into a junkie or something. I'm just having some fun with my friends right now.
So acting like a junkie scares you.
Yeah, the other night I did something pretty stupid and just grabbed a needle and shot up without thinking.
Without thinking.
Oh, yeah, I wasn't thinking about catching AIDS or anything. Some people had really used it, had already used it.
So you've been worried that you could have HIV or another STI ever since, and that's part of the reason you took the initiative to come to talk to me.
Yeah, I don't know what I'd do if I found out I had AIDS, but those are the only guys I share with, and I'm pretty certain none of them has anything. Then again, one of them could be too embarrassed to tell me.
They might keep it to themselves, and that's a big risk for you.
They're junkies, so it's definitely possible.
Seems like junkies aren't the most trustworthy people in your book.
A junkie will steal your wallet and help you look for it.
A junkie can't be trusted, and you don't want to be one of them. You want to do things with your life.
Yeah, I've been thinking that maybe I should get my own needle, but it's just almost like then I'd be an addict, you know?
In your eyes, owning your own needle means that you've gone too far into the addiction. which comes with all sorts of problems, and that's scary. At the same time, you don't want to risk an STI, especially something as serious as HIV, by sharing needles with other people.
Yeah, it's a lot to think about. Now that you got me talking about it, I think I want to go get an HIV test today. Maybe afterward we can talk some more about this.
Hey, roller coaster hands to our 2 volunteers. Thank you very, very much. Here we have another motivational interview. Counselor started with an open-ended question, and following that, it's one reflection after another. 9 reflections, one open-ended question. Working in the spirit of motivational interviewing. Oftentimes, we rarely have to ask questions because the reflections do the work. This interviewer is off the charts when it comes to the reflection to question ratio, 9-to-1, 9-to-1. The voice of the client is always key. The words in red are the ones I was drumming to. There's the change talk. People change when they hear themselves talk about the need to change. So let's return to Washington State, these behavioral health practitioners who are working with folks who have voluntarily entered isolation and quarantine sites. The following interview is with another person who has been living on the streets. So we have a practitioner who says to this guest, "Hello, I hear you are feeling better and want to get out of here. Can we talk for a few minutes?" And this guest says, "I feel better and want to go home. No offense, but I hate this place." Your job right now, either on a piece of paper or on your chat, in your chat, is to write down briefly what you would reflect back to this person, to this guest, to let them know you're trying to understand things from their perspective. So what would you reflect back? And you have 30 seconds to do so. What would you reflect back? So we're going to stop there. And the next step is I'd like to read many of your reflections or intended reflections. And I'm wondering, would you all be okay with me offering you some fine-tuning feedback and making comments on your reflections? And if you're okay with that, please give me some sort of thumbs up right now. I want to make sure you're okay with me commenting and offering feedback so I can see that we're good to go. So the first reflection, I understand that you don't like being here, and I'm going to snap. And I'm going to be sharing some general guidelines right now about reflecting. Usually, we want to avoid the word I. And the word that we want to emphasize is the word you. Most people, when they're reflecting, they announce their reflections. There's a prelude where we say things like, "It sounds like," or "I'm hearing you say," or "I understand that you blah, blah, blah." And as a general guideline, I'm going to encourage you all to drop that announcement, because when we do that, regularly, it starts to make our reflections sound clinical, or it makes it sound like we're doing something. And we want our reflective listening to sound very natural, very authentic. So instead of, I understand that you don't like being here, you just reflect, you don't like being here. Here's another one. You don't like being here and would rather be at home. So the reflection begins with the word you, with the word you. It sounds like you are feeling better. Drop, it sounds like, and just reflect, you're feeling better and you're ready to go home because this is not your happy place, or whatever the words are that you want to bring into your reflection. So you're eager to get back to your life. The reflection begins with the word you. So you're feeling better and ready to leave, huh? So many of our reflections begin with the word so. So you. And with that response, I'm going to drop, I'm going to encourage you to drop the word huh, H-U-H, because that's a closed-ended question at the end of your reflection. What many of us do is say, you're feeling better and ready to go home. Is that right? Drop the closed-ended question and just stay with the reflection. So this interview continues. This is what this person said next. I haven't seen my friends in a while, and there's no way to get in touch with them. You have 30 seconds to craft a reflection for these words. And really think about the word you, or so you. Stop. And if you're thinking, dang, that was not enough time. That was not enough time, Steve. You know how much time you get in real life? Instantaneous. And that's what we're working on here, is those instantaneous reflections where I'm not thinking about it. I'm not thinking about it. So here's a reflection. You really miss your friends. It's hard not seeing your pals. You're feeling disconnected from your friends. You're feeling lonely and you miss the connection of those that you hang out with. You're feeling lonely. When we start to reflect feelings like you're feeling lonely, ooh, that's what we call a deeper reflection, where people really start to feel understood. This is what this guest said next in this real dialogue. You know, living on the streets, we take care of each other, you know? I don't know how they're doing. I don't know how they're doing. You have 30 seconds to reflect these words. You miss your support system. It's been hard not to be connected with them. You're worried about your friends. You're concerned about your friends. Oh, they have your back. And not knowing what's going on is concerning. You're worried about your friends, and you definitely want to be able to check in with them. You care for your friends and their well-being. You are concerned about your friends, and you all look out for each other. Now, this is what this client said next. Well, I know I'm supposed to stay here for a few more days. Well, I know I'm supposed to stay here for a few more. Reflect those words. Now, I want to tell you, if you're struggling with what we're doing right now, you're definitely not the only one. What we're doing right now, this is not easy. And this takes practice. It's not something that many of us are used to doing. And, and most of us who do reflect, we know tend to reflect in a very simple way, where we're just reflecting words. And part of the art of motivational interviewing is going beyond the words and capturing not what the person said in words, but what they're definitely conveying between the words. Here's some of your reflections. You feel it's important to wait a few more days before going back to your friends. Um, you'll, so you recognize that staying here a while longer might be a good thing. So you understand the importance of staying here. You know it's best to stay here a few more days. So here's a question. Why should you stay here for a few more days? Now, I'm going to invite you all to park questions right at this point. Park the questions, because usually the reflections will do the work. So you could say, well, I know I'm supposed to stay here for a few more days. Oh, so you understand that staying here a few more days is probably in your best interest. And the person says, yeah. So then you might say, so what are some of the reasons why you think staying here might be a good idea? So generally we reflect first. The way we reflect first. Oh, you've been told that you should stay here a bit longer. So this is what this person said next. I really do want to get out of here, but I don't want my friends to have to deal with this coronavirus crap like I have. Who's talking themselves into staying there? The guest is. Reflect those words. Just reflect. No questions, no information. You're not agreeing with them. You're reflecting what they are telling you. Wow, you value the health of your friends. You're doing the hard part by keeping distance from your friends. Man, you don't want your friends to end up here also. It's really important to you to keep your friends safe. You want to be safe to be sure that when you go back out there, you're not going to infect them. You care about your friends and don't want them to go through what you've had to. Man, recovering from the virus is hard. And you don't want your friends to have to go through that either. You're feeling scared for yourself and your friends, and staying here a bit longer, as you can see, is a safe thing to do. So sounds like you're informed about some of the risk. Drop, it sounds like. Oh, you know what the risks are of the coronavirus. And that's why you're choosing to stay here a bit longer. So we could spend many days together working and practicing what we're doing right now. This is an art form, reflective listening, and it's the primary skill that motivational interviewing is built on. And I can tell you, just looking at many of your reflections, you all have a strong foundation in how to do it. So I'm going to switch gears on you right now in your handout packet. If you could turn to page 5, page 5. And you're going to see a bunch of circles on page 5. And what I'm going to have you do in just a moment is place in the circles some parts of your life that could use some changing, some parts of your life that could use some fine tuning, parts of your life that you've been neglecting. So for example, before you start your own menu, I created one for myself, and I won't go into specifics about why I put these things in circles, but we got helmet wearing in the context of riding my bicycle, sleep, physical therapy for my right hip, and fast driving. So your job right now is to do what I've done and place in the circles some parts of your life that could use some change. And because you put it in a circle doesn't mean you're going to change it. It's just something you recognize that it could use attention. Make sure you leave at least one circle blank, at least one circle blank. So what I'd like to do right now is something a little awkward, and I'm feeling called to do it. What I'd like to do briefly, and we're definitely coming towards the end of our time, I'd like to model for all of you several different aspects of a motivational interview, with you all being my client as a group. And for this interview, I'm going to encourage all of you to pick one topic that you identified in a circle that you'd be willing to do some exploration on your own. You're not going to talk about it. It's just something you're going to explore on your own. And I'm going to be Steve, the interviewer. I will stop action at several moments with my rattle. Malcolm will come on board. We'll say a few things about what just happened. Steve will come back, and there'll be that back and forth. So these circles, this is a tool that's been derived from motivational interviewing, oftentimes called a circle menu. A circle menu. And I'm going to demonstrate in a moment how this menu works. First, in motivational interviewing, there are 4 fundamental processes that hold the conversation together: engaging, focusing, evoking, and planning, if the person is ready. Here's the essence of MI. You settle into a helpful conversation. You find a useful direction, focus. You draw out their own good reasons to change, evoke, and if they want to, and they're ready to, support them to plan the changes. So I'm going to begin the conversation right here with you all. Hey, good afternoon. You know, if we have not met, my name is Steve, and one of the things that I do in my work is I work as a health and wellness counselor. And that's a fancy way of saying that my job is to work together with people in making decisions about what, if anything, they might want to change in their life as a way of improving their health and well-being. Now, we've got about 5 minutes to meet right now. And I was hoping to spend this time talking about a part of your life. If you made a change in that part of your life, it would really support your health and well-being and everything. And I'm wondering, would you be okay with us doing that? And if you're cool with it, please give me a thumbs up one way or another. If you're cool with it, thumbs up one way or another. If you're not cool with it, what you may do is mute yourself or completely go offline right now, because hey, it's Malcolm. Steve has stepped aside. What we know is that getting started with conversations is sometimes the hardest part. Sometimes the hardest part. We know that the first 30 to 60 seconds of any interview is the most important moment, where we establish trust and safety and rapport. What Steve just modeled are some of the core ingredients of getting started in conversations. Getting started in a way to support the client in feeling in control. When people know the parameters, when they know the agenda, when they know who you are, when they know what your role is, when they know how much time there is, and when you ask permission, it supports people in feeling in control. All right, Steve's back here with you. And I've got a question to ask you all. You looking at all the topics in the circles, I'm wondering which one is the one that is shining at you like a neon light. In other words, which topic do you see in a circle that if you made a change in, man, you definitely know it would serve you and really benefit you. And if you know what that topic is and you'd be interested in exploring it for just a bit, highlight that topic, circle it again, put a star next to it. Or is there something else that you'd rather talk about, that you're thinking about right now, that you could place in a blank circle and pick that topic? And after you have that topic picked, I'm wondering, would you be okay in spending a couple minutes right now focusing on that topic and exploring it a bit? And if you're cool with that, please give me another thumbs up. And if you're not interested in exploring it, you don't have to. So Steve is going to step aside, and we've got Malcolm here again. Oh, Steve is doing some really interesting things. Steve was using a tool. When you have different topics that you could address with somebody, this is a tool that can support there being focus in the conversation, because there's 4 things that we know about change that Steve was modeling. First off, we know that people are more likely to make change when they're presented menus, when they're presented a menu. We also know that people are more likely to make change when the client is the one that picks the topic, rather than you doing it for them. We also know that people are more likely to make change, generally when there's a focus on one topic rather than on several topics or the whole kitchen sink. And lastly, it's been suggested that a lot of people are more inclined to talk about sensitive topics when those topics are placed in circles. And when those circles are presented to the person randomly with no hierarchy. And the thinking is that the circle is the most universal, historical, cross-cultural image and shape we have that represents containment and boundaries and safety and protection. So let's bring Steve back in the mix here. If you all turn to page 6, please. And in page 6, there are some questions that I am going to ask you right now about the part of your life that you identified in a circle. So it is Malcolm once again. So for the sake of time, Steve is not in a position to guide you through a conversation right now with everything on page 6. And I'll tell you right now, the questions on page 6, this is the heart of motivational interviewing. These are the kinds of questions that we explore with people to start to bring to the surface their change talk, their motivation. So Steve was going to go through a number of different questions with you. And then there was going to come a moment in the interview where Steve was going to get a sense on whether or not you are ready to move in the direction of planning and goal setting and action planning. All right, it's me again. And we could have spent a solid 15 minutes doing what I just got started with. And that's an attempt to give you a flavor of the big picture of motivational interviewing. And this is where we're going to go right now. If you could turn to page 8 one last time. And on page 8, here's your bucket. And if you could take a final 30 seconds to reflect on what your pearls and keepers have been from our very brief time together. This has been a very brief dose of MI training. And based on this brief dose, what are your remaining final key learnings? And connected to what's in your bucket, I have another question to ask you. On the bottom of the bucket is a circle. And we're going to call that circle your King Kong Rockstar Pearl from our time together. And if you could identify one learning in your bucket that completely stands out, the one learning that you definitely don't want to forget, the one learning that you're definitely taking from this experience that you will never forget, and rewrite it in that big circle on the bottom of the page. And we're going to call that your King Kong Pearl, your King Kong Pearl. So I'm going to pull up a final polling question for all of you. And I'm going to launch the poll. We've got 5 minutes left. And so how helpful was this training for you? And you have some possible responses here. And I will finish that story at the end. I do have a song queued up, courtesy of my daughter. a song that you said, oh, everyone's going to enjoy this song on a Friday. You have a few more moments here to reflect on how helpful this training has been. I'm going to end the poll. This is where we stand as a group. Really appreciate the feedback. And I have another question to ask you all. On a scale of 0 to 10, how confident are you in your ability to mobilize and activate clients' internal motivation to make and sustain the important changes that you're supporting them in making around housing, a roof over their head, living a thriving life? You circled a number at the beginning. If you could put a triangle around the number that captures right now where your confidence stands. If you'd be willing to respond to this question also in the poll. So I'm going to end the poll and share the results. And as you can see, we've got 2, 4, 6, 7, 8, 9, moving all the way up to 10. Earlier, we had a range that went from 1 to 9. And the number that was most populated this morning when we started was the number 5. So as you can see, there's been a shift in your confidence. And the final open-ended question I'm going to ask you all is, how come many of you are feeling more confident than when you started today at 9 o'clock? And if you'd briefly be willing to place your response to that question in your chat. So some of the reasons why some of you are feeling more confident. There was that role play because I've been hitting roadblocks with clients. And now I can see what I needed to work on, how you broke it down for us, because my instinct is to fix. Other reasons why you might be feeling a bit more confident. I will finish the story, I promise you. Being able to focus on measurables like increasing the number of reflections and open-ended questions and conversations. That's the science of MI. I feel more educated. I have it more broken down into pieces. This reinforces what I remember. Practicing reflections to draw out. All right. So I'm going to suggest that one of the reasons why you're more confident, you got pearls in your bucket. Here's the MI bottom line. This skill is sophisticated. It is. It's an art form. It requires a lot of practice and feedback. It's like learning to play a musical instrument, and if you don't use it, you lose it. Here's the Motivational Interviewing website. I'm part of an international network of MI trainers. We come from 52 countries. There's about 1,500 of us. And if you want to learn a lot more about MI, the research, the evidence, resources, training opportunities, becoming a trainer, this website, a wealth of information. Here's my email. Here's my website. Stay in touch. Hopefully we'll cross paths again. Here's the North Star that I brought forward, where I was hoping we'd end up to after being together. for this brief half day. Give me a thumbs up generally if you feel like we hit the mark here. Yeah, good. So let's end with the cliffhanger story. This will be brief because I had the finger in my chest from this gentleman. He's screaming at me, spitting at me. If you're here to talk to me about my blankety blank smoking, you might as well get your little blankety blank out of here. I start backpedaling down the hallway. And I said something that is very disarming in the spirit of MI. I said, thank you for letting me know where you're coming from. Smoking is your business. So I immediately extended gratitude and I acknowledged his autonomy. I turn around, I'm going down the hallway, and he screams, is smoking's my blankety blank business, and why did you bring your little blankety blank in here? I then turn around, I take a few steps towards him, and I said, well, let me introduce myself. I'm Steve, I'm one of the counselors here. My job is to talk to folks about what, if anything, they might want to change in their life as a way of improving their health and well-being. And I sometimes talk to people about their smoking, and I can hear in you loud and clear, you have no interest in talking about that. I turn around, go down the hallway, and he screams and he says, stop. I turn around and he looked at me and he said, I'm sick of these cancer sticks. I need to quit. Can you help me do it? Change talk. I then take several more steps towards him and I said, you're done with smoking and you're hoping I can help. And he said, damn right, I'm hoping you can help. Come on in and help me do it. And I came in. He said, sit down. Who's in charge? He is. Who's guiding the conversation? I am. I sit down, and the next thing is he starts crying, starts bawling. And the main thing that he started bawling about was his son and the kind of dad that he's not, and who he wants to be as a dad, and how he's not honoring his core values. So I get to tell the good stories, and it's been an honor hanging out with you. And I hope you have your own success with motivational interviewing, and perhaps we'll cross paths again. Here's the tree between a rock and a hard place. Even in the most adverse conditions, we can choose to continue to grow and change. You all have a great week.